The Futures Planning Office occupied a space that existed somewhere between the archives of completed cases and the active investigations that filled the daily rhythm of police work. Detective Lieutenant Sarah Chun had been assigned to this unique position 18 months earlier, tasked with analyzing patterns from decades of resolved cases to understand how communities could prevent problems before they required formal law enforcement intervention. The office itself reflected this liminal quality, furnished with comfortable chairs that encouraged reflection and equipped with computer systems that could access both historical archives and real-time community data. Windows faced in all directions, providing views of the city that encompassed both its established neighborhoods and the areas where new development was creating opportunities for innovative approaches to community safety. Sarah had spent her morning reviewing reports from community liaisons throughout the city, individuals who had been trained to recognize early signs of social stress that might eventually manifest as criminal behavior if left unaddressed. These liaisons included teachers, healthcare workers, business owners, and longtime residents who had developed the kind of deep community knowledge that made effective prevention possible. The reports painted a picture of a city that had learned to address its problems proactively, with networks of formal and informal support that could respond to emerging challenges before they became crises. Sarah's role was to identify patterns in these reports that might indicate opportunities for new prevention programs or modifications to existing approaches that had proven successful in other contexts. She turned her attention to a cluster of reports from the Riverside District, where several community liaisons had noted increased stress among families dealing with economic uncertainty related to changes in the local manufacturing sector. The reports described a pattern of minor conflicts that suggested families were struggling to adapt to new circumstances without adequate support systems. Sarah had learned to read these early warning signs as opportunities for intervention rather than predictions of inevitable problems. The city had developed a comprehensive network of resources that could be mobilized quickly when community liaisons identified emerging challenges, preventing minor stresses from escalating into situations that might require formal law enforcement response. She began drafting a recommendation for expanded economic support services in the Riverside District, drawing on successful models that had been implemented in other areas during previous economic transitions. The recommendation would be reviewed by a committee that included representatives from police, social services, economic development, and community organizations, ensuring that responses were comprehensive and well coordinated. The morning's second set of reports came from school liaisons who had been monitoring patterns of student behavior that might indicate family stress or community problems. These reports had become invaluable tools for early intervention, allowing problems to be addressed while they were still manageable rather than waiting until they affected academic performance or required disciplinary action. One report that caught Sarah's attention described a pattern of increased tardiness and absenteeism among students from a particular neighborhood, suggesting that families might be experiencing transportation or childcare challenges that could create broader stress if not addressed promptly. The school liaison had already begun informal conversations with affected families to understand their specific circumstances and identify appropriate resources. Sarah coordinated with the city's transportation department to explore options for improved bus service to the affected neighborhood, while also working with community organizations to identify volunteers who could provide emergency childcare or transportation assistance during family crises. These kinds of coordinated responses had proven remarkably effective in preventing minor logistical problems from becoming major family disruptions. The afternoon brought reports from healthcare liaisons who monitored emergency room visits and other medical contacts that might indicate underlying social problems requiring community response. These reports had been particularly valuable in identifying domestic violence situations, substance abuse problems, and elder abuse cases before they reached levels that required Criminal justice intervention. One report described an elderly man who had been visiting the emergency room repeatedly for minor injuries that suggested he might be experiencing falls or other problems related to living alone without adequate support. Rather than waiting for a more serious incident to occur, the healthcare liaison had already begun conversations about home safety assessments and companion services that could help the man maintain his independence while reducing his risk of injury. Sarah worked with the city's Aging Services Department to ensure that appropriate resources were available for the situation, while also reviewing patterns in similar reports to understand whether additional preventive services might be needed. For other elderly residents facing comparable challenges, the late afternoon brought what Sarah had come to think of as the most important part of her work, analyzing longer-term trends that might indicate opportunities for systemic improvements in how the city addressed community safety and social problems. This analysis drew on data from multiple sources, including crime statistics, social service utilization, economic indicators, and community satisfaction surveys. Current trends showed continued improvement in all measures of community safety and well-being, with particularly impressive progress in areas where comprehensive prevention programs had been operating for several years. However, Sarah had learned to look beyond these positive indicators to identify emerging challenges that might require new approaches or modifications to existing programs. One trend that deserved attention was the gradual aging of the population in several established neighborhoods, which would create new needs for services and support systems, while also providing opportunities for older residents to serve as mentors and resources for younger families. Sarah began developing recommendations for intergenerational programs that could address both sets of needs simultaneously. Another trend involved the arrival of new immigrant families who brought valuable cultural resources to the community, but who might need assistance navigating local institutions and establishing the social connections that promoted integration and mutual support. Sarah worked with cultural organizations and established immigrant communities to develop welcoming programs that facilitated successful settlement while enriching the broader community. The evening brought the most reflective part of Sarah's work, reviewing case studies from other cities that had implemented innovative approaches to crime prevention and community building. These studies provided insights that could be adapted to local circumstances, while also offering perspective on the broader movement toward community-centered approaches to public safety. One case study that particularly interested her described a city that had eliminated traditional police patrols in favor of community problem-solving teams that included law enforcement officers, social workers, healthcare providers, and resident volunteers. The teams had proven remarkably effective in addressing problems before they became criminal matters, while also building stronger relationships between residents and public safety professionals. Sarah began exploring how similar approaches might be adapted to local circumstances, considering which neighborhoods might be appropriate for pilot programs and how existing resources could be reorganized to support more integrated service delivery. The analysis would require extensive community input and careful planning, but the potential benefits were significant enough to justify serious consideration. As night settled over the city, Sarah turned her attention to what she considered the most important aspect of her work, understanding how today's prevention efforts would influence tomorrow's community safety and social cohesion. This long-term perspective required thinking beyond immediate problems and solutions toward the kind of community that current efforts were helping to create. The data suggested that the city was developing what researchers called collective efficacy, the capacity for residents to work together effectively to address shared problems and maintain social order through informal means rather than relying solely on formal institutions. This collective efficacy was the foundation for sustainable community safety that could adapt to changing circumstances while maintaining its essential character. Sarah's reports documented how this collective efficacy was developing through countless small interactions and collaborative efforts that built trust and shared responsibility over time. Neighborhood associations had become more active and effective. Community gardens had created opportunities for informal cooperation, and various cultural and recreational programs had provided venues for relationship building across different groups within the population. The development of collective efficacy was not automatic or inevitable. It required conscious effort and appropriate support from institutions that understood their role in facilitating rather than controlling community processes. Sarah's work involved identifying ways that formal institutions could provide this support without undermining the organic development of community capacity. One area that showed particular promise involved what researchers called community learning networks, informal systems through which residents shared knowledge and resources that helped everyone address common challenges more effectively. These networks had emerged naturally in several neighborhoods, but they could be strengthened through modest institutional support that provided meeting spaces, communication tools, and connections to professional resources when needed. Sarah had been documenting how these learning networks operated and identifying ways they could be supported and replicated in other areas. The network seemed to be particularly effective at preventing problems that traditional social services had difficulty addressing, such as social isolation, intergenerational conflict, and cultural misunderstandings that could escalate into more serious community tensions. As she concluded her work for the evening, Sarah reflected on how her role represented something new in law enforcement, a position focused entirely on understanding and supporting the social conditions that made formal law enforcement unnecessary in most situations. Her work was prevention in its purest form, addressing problems at their roots rather than responding to their symptoms. The Futures Planning Office had been created based on recognition that the most effective crime prevention occurred through community development rather than traditional law enforcement strategies. Sarah's position represented the city's commitment to learning from decades of experience, with community policing approaches while continuing to innovate and improve. The office maintained relationships with universities and research institutions that studied community safety and social cohesion, ensuring that local prevention efforts incorporated the best available knowledge, while also contributing to broader understanding of what worked in different contexts. Sarah regularly participated in conferences and professional networks that shared information about innovative approaches to crime prevention and community building. However, the most important aspect of her work remained deeply local, understanding the specific circumstances, resources, and needs of the community she served, while helping to coordinate responses that drew on both professional expertise and resident knowledge and capacity. As Sarah prepared to leave the office, she reviewed the day's accomplishments and planned tomorrow's activities. The work was never finished because communities were constantly changing and developing new needs and opportunities. But it was deeply satisfying because every small improvement in prevention and community building created the foundation for future progress. She walked through the quiet corridors of the municipal building, passing offices where other city employees had spent their day providing services and support that contributed to community safety and well-being. The work of maintaining safe and healthy communities required collaboration among many different professionals and institutions, but it ultimately depended on the capacity of residents to work together effectively in addressing their shared challenges. The city spread out around her in the darkness, its neighborhoods filled with families and individuals who were living their daily lives with increasing confidence that their community provided both safety and opportunity for positive engagement. The transformation that had occurred over decades of patient work was not complete and never would be, but it had created the foundation for continued progress toward ever more effective and humane approaches to community safety. In the streets and houses that surrounded the municipal building, residents were settling into evening routines that included the kinds of informal social connections and mutual awareness that provided the foundation for community safety. Children played in yards and parks that were maintained through collective effort. Elderly residents felt secure in homes that were part of neighborhoods where people looked out for each other. And families facing various challenges had access to resources and support that helped them address problems before they became crises. The work would continue tomorrow and the day after that, as community members and public safety professionals collaborated in the endless task of building and maintaining social conditions that allowed everyone to thrive. Each day brought new opportunities to prevent problems, strengthen relationships, and create innovations that could benefit other communities facing similar challenges. Sarah understood that her work represented just one small part of a much larger movement toward approaches to public safety that emphasize prevention, community building, and restoration rather than punishment and social exclusion. Communities throughout the country and around the world were experimenting with similar approaches, learning from each other's successes and failures while adapting proven strategies to their own unique circumstances. The future that her office was helping to plan was not predetermined, but was being created through the accumulated effects of thousands of daily decisions by residents, professionals, and institutions that chose collaboration over conflict, understanding over punishment, and prevention over reaction. Each small success created the foundation for larger transformations that could benefit future generations. In the peaceful darkness of the city at rest, Sarah felt the deep satisfaction that came from participating in work that addressed problems at their source while building the kinds of communities where crime prevention occurred, naturally through social connections and mutual support, rather than through fear and formal control. The stories that would fill tomorrow's case files were not yet written, but the conditions for their positive resolution were being created through the patient work of community building that proceeded quietly but persistently in neighborhoods throughout the city. Each prevented problem, each strengthened relationship, each successful collaboration contributed to a future where effective responses to social challenges would be increasingly available through community resources rather than formal intervention. The cycle of human conflict and peaceful resolution would continue, but it would occur increasingly within communities that had developed the capacity to address problems through understanding and mutual support, creating stories that would someday join the archives as evidence of humanity's endless capacity for learning, growth, and positive change. The Community Liaison Center occupied a converted Victorian house on Elm Street. Its wraparound porch and comfortable sitting rooms, creating an atmosphere more like a neighborhood gathering place than an official government building. Social worker Elena Rodriguez had helped design this space 3 years earlier, understanding that effective crime prevention often required environments where people felt welcome to share concerns and seek assistance. Before problems became emergencies, the morning sun filtered through lace curtains in the main meeting room, where Elena was reviewing notes from yesterday's informal conversations with residents who had stopped by during the center's regular drop-in hours. These conversations rarely dealt with crimes in progress, but they provided invaluable insights into the social currents that could eventually influence community safety and well-being. Mrs. Dorothy Patterson, a longtime resident of the neighborhood, had mentioned that she was concerned about her new neighbor, a young single mother who seemed overwhelmed by the challenges of caring for 2 small children while working multiple part-time jobs. Mrs. Patterson had not witnessed any specific problems, but her experienced eye had noticed signs of stress that suggested the family might benefit from additional support. Elena made a note to visit the family later in the week, not as an official investigator, but as a community resource person who could provide information about child care assistance. job training programs, and other services that might help reduce the stress that could eventually lead to family crisis. This kind of early intervention had proven remarkably effective in preventing situations that might otherwise require formal social service or law enforcement involvement. The center's kitchen served as an informal gathering place where neighbors could share coffee and conversation while children played in the adjacent family room. Elena had observed how these casual interactions often revealed community needs and resources that formal assessment processes might miss, creating opportunities for informal mutual support that strengthened the entire neighborhood. During yesterday's coffee hour, several residents had discussed their concerns about teenage vandalism in the small park 2 blocks away. Rather than calling police to increase patrols, the group had begun planning a community cleanup and improvement project that would create more positive activities in the park while also increasing the natural surveillance that discouraged unwanted behavior. Elena had facilitated this discussion by providing information about city resources that could support community improvement projects while also connecting the group with other neighborhoods that had successfully addressed similar challenges. Her role was not to solve problems for residents, but to help them develop their own capacity for effective collective action. The center's resource library contained information about everything from job training and educational opportunities to healthcare services and recreational programs, organized to help people quickly find assistance for specific needs, while also discovering related resources they might not have known existed. Elena had learned that effective community support often involved helping people understand the full range of options available to them. One section of the library focused specifically on conflict resolution and communication skills, providing materials that help people address interpersonal problems before they escalated to levels requiring outside intervention. These resources have been particularly valuable for neighbors dealing with property disputes, family conflicts, and other situations where patient mediation could prevent longer-term problems. The center also maintained connections with professional mediators who could provide assistance with more complex conflicts, creating a continuum of support that could address problems at whatever level of intervention was most appropriate. Elena had found that many conflicts could be resolved through informal discussion and education, while others required more structured processes that still emphasized restoration rather than punishment. The afternoon brought Elena's favorite part of her work, conducting what she called neighborhood walks with residents who wanted to discuss community concerns in the context of the physical spaces where they lived and worked. These walks provided insights into local dynamics that could never be gained through office consultations or formal meetings. Today's walk included Mrs. Chun, an elderly resident who had lived in the neighborhood for 40 years and possessed encyclopedic knowledge of local history and social patterns. Mrs. Chun had requested the walk because she was concerned about changes in the business district that might affect community character and safety. As they walked along the main commercial street, Mrs. Chun pointed out businesses that had changed hands recently, noting how different ownership and management styles affected the kinds of customers they attracted and the role they played in neighborhood life. Her observations revealed subtle changes in social dynamics that could influence everything from foot traffic patterns to informal surveillance networks. One new restaurant had installed outdoor seating that created opportunities for casual social interaction, while also providing additional eyes on the street during evening hours. Mrs. Chun had noticed that the improved lighting and increased activity had made the surrounding area feel safer for pedestrians, demonstrating how business decisions could have positive effects on community safety. Conversely, another business had removed seating areas and installed security measures that made the space feel less welcoming, potentially reducing the kind of casual foot traffic that provided natural security for the entire block. Mrs. Chun suggested that Elena might want to speak with the business owner about alternative security approaches that could address their concerns without creating barriers to community engagement. The walk continued through residential streets where Mrs. Chen had observed changes in property maintenance, social interactions, and general neighborhood atmosphere. Her experienced perspective helped Elena understand how seemingly minor changes could accumulate over time to affect community cohesion and safety. One area that had improved significantly was a section of rental properties where new management had invested in landscaping and exterior improvements while also implementing tenant screening that attracted more stable residents. Mrs. Chun had noticed that children in the area were playing outside more frequently and that neighbors were engaging in more casual conversation, signs of increased community comfort and connection. Another area showed signs of decline that Mrs. Chun traced to absentee ownership and deferred maintenance that had created conditions attractive to transient residents who had less investment in maintaining community standards. Elena made notes about resources that might help property owners address maintenance issues while also exploring ways to connect newer residents with community activities that could promote integration and mutual support. The evening brought Elena's work with what the center called community circles, small groups of residents who met regularly to discuss neighborhood concerns and coordinate informal responses to emerging problems. These circles had evolved organically as residents discovered the benefits of regular communication and collective problem solving. Tonight's circle included 8 residents representing different ages, backgrounds, and perspectives, but united by their shared investment in maintaining a safe and welcoming neighborhood. The group had been meeting monthly for 2 years, developing trust and communication skills that allowed them to address sensitive issues with patience and respect. The current discussion focused on a family that had moved into the neighborhood recently and seemed to be struggling with the transition. The parents worked different shifts, leaving their teenage children unsupervised during evening hours when minor conflicts with neighbors had begun to occur. Rather than viewing these conflicts as discipline problems requiring outside intervention, the circle participants understood them as signs that the family needed assistance with integration into community life. They discussed ways to welcome the teenagers into existing activities while also providing the parents with information about resources that could help them manage work and family responsibilities more effectively. One circle member offered to introduce the family to other parents who had successfully navigated similar challenges, while another suggested involving the teenagers in a community garden project that provided positive social interaction while teaching valuable skills. Elena's role was to facilitate the discussion while providing information about formal resources that could supplement community support. The circle also addressed a property maintenance issue that had been creating tension between neighbors, with one resident's yard becoming overgrown in ways that affected adjacent properties. Rather than filing complaints with city authorities, the group discussed ways to approach the situation with understanding and practical assistance. Further conversation revealed that the property owner was an elderly man who had recently lost his wife and was struggling with depression that made it difficult for him to maintain his usual standards of home care. The circle members organized to provide practical assistance while also connecting him with grief counseling and social activities that could help him through his difficult transition. These kinds of informal interventions had proven remarkably effective in preventing minor problems from becoming major community issues while also strengthening the social connections that made neighborhoods more resilient in the face of various challenges. As the circle meeting concluded, Elena reflected on how much the neighborhood had changed since the community center had opened 3 years earlier. Crime statistics showed significant improvements, but more importantly, residents reported feeling more connected to each other and more confident in their ability to address problems collectively. The changes had not occurred automatically but had required sustained effort from many. People who had committed themselves to building the kinds of relationships and communication patterns that made effective collaboration possible. Elena's role had been to facilitate and support these efforts while providing connections to professional resources when they were needed. The success of the Elm Street model had attracted attention from other neighborhoods and communities that wanted to develop similar approaches to crime prevention and community building. Elena had begun providing consultation to groups that were organizing their own community centers and support networks, sharing lessons learned while helping them adapt successful strategies to their own unique circumstances. However, she had learned that the specific techniques and programs were less important than the underlying commitment to treating residents as capable partners in addressing community challenges rather than passive recipients of services provided by outside professionals. Successful community building required recognizing and supporting the wisdom and resources that already existed within neighborhoods. The center's approach had also influenced how other city departments and agencies provided services in the area, with increased emphasis on collaboration and community engagement rather than top-down program implementation. Social services, police, parks and recreation, and economic development all had begun coordinating their efforts more effectively while involving residents in planning and evaluation. This coordination had produced synergistic effects that multiplied the impact of individual programs, while also ensuring that interventions addressed problems comprehensively, rather than focusing on isolated symptoms. Elena had observed how this integrated approach had created more sustainable improvements that continued to develop over time rather than requiring constant external support. As Elena prepared to close the center for the evening, she reviewed the day's activities and planned tomorrow's schedule. The work was never finished because communities were constantly changing and developing new needs and opportunities, but it was deeply satisfying because every small improvement in community connection and problem-solving capacity created the foundation for future progress. She walked through the neighborhood toward her own home, observing the quiet evening activities that indicated a community where people felt safe and connected. Children played in yards while parents engaged in casual conversation with neighbors. Elderly residents tended gardens that created opportunities for informal social interaction, and various small groups gathered on porches and sidewalks for the kinds of spontaneous socializing that built community resilience. The transformation had been gradual and often invisible to outside observers, but residents understood that their neighborhood had become a place where problems were addressed before they became crises, where newcomers were welcomed and integrated, rather than isolated, and where the daily rhythms of life included the kinds of mutual awareness and support that made formal intervention unnecessary in most situations. Elena understood that her work represented just one example of approaches to crime prevention and community building that were being developed in countless communities throughout the country and around the world. Each community had its own unique resources and challenges, but the underlying principles of resident engagement, early intervention, and collaborative problem-solving could be adapted to virtually any setting. The future that was being created through this patient work was not predetermined, but was emerging through the accumulated effects of thousands of daily interactions that chose cooperation over conflict, understanding over judgment, and prevention over reaction. Each strengthened relationship, each successful collaboration, each prevented problem contributed to a foundation for continued progress toward ever more effective and humane approaches to community safety. In the peaceful darkness of Elm Street, where neighbors had learned to care for each other with the same attention they gave to their own families, the work of building community continued one conversation at a time, one act of mutual support at a time, creating the conditions where human beings could live together safely and peacefully even in an uncertain world. The stories that would emerge from tomorrow's community interactions were not yet written, but they were being shaped by today's investments in relationship building and collaborative problem solving, creating a legacy of community strength that would benefit future generations while serving as a model for other communities, seeking their own paths toward effective crime prevention through social connection and mutual care. Asterisk, the Training Academy's courtyard garden had been designed as a place of reflection, where new officers could sit quietly between classes and contemplate the profound responsibilities they were preparing to accept. Veteran Sergeant Michael Torres, now 58 years old with 34 years of service, had requested this particular setting for his final mentoring session with the Academy's newest class, understanding that the most important lessons were often learned in moments of calm contemplation rather than intense instruction. The evening light filtered through mature oak trees that had been planted when the Academy was first built, their branches creating patterns of shadow and illumination that seemed to shift with the rhythm of quiet breathing. 8 new officers sat in a semicircle around Sergeant Torres, their notebooks closed, their attention focused not on memorizing procedures, but on absorbing the deeper understanding that could only be shared through stories and reflection. Officer Jennifer Martinez, fresh from her college criminology program, had been surprised to learn that this final mentoring session would focus not on arrest techniques or legal procedures, but on what Sergeant Torres called the heart of police work, the patient art of understanding human nature and helping communities heal from the conflicts that inevitably arose when people lived together in complex social arrangements. Sergeant Torres began with a story from his early years as a patrol officer, when he had responded to what seemed like a simple domestic disturbance, but had discovered a family struggling with unemployment, illness, and the kind of accumulated stress that could transform loving relationships into sources of conflict and pain. His initial training had prepared him to assess immediate safety risks and restore order, but it had not taught him how to address the underlying problems that had created the crisis. The resolution had required multiple visits over several weeks, during which Sergeant Torres had learned to listen carefully to each family member's perspective while helping them access resources that addressed their practical needs and emotional challenges. The process had been slow and sometimes frustrating, but it had produced lasting changes that prevented future crises while strengthening the family's capacity to manage stress collaboratively. Officer David Kim, whose previous career in social work had given him experience with family intervention techniques, asked about the specific skills that were most important for this kind of extended engagement. Sergeant Torres explained that effective community policing required the ability to see beyond immediate symptoms to underlying causes, the patience to build trust gradually rather than expecting instant cooperation, and the humility to recognize that residents often understood their own situations better than outside professionals. The conversation moved to a case from Sergeant Torres's middle years, when he had been assigned to investigate a series of vandalism incidents in the downtown business district. Rather than simply increasing patrols and making arrests, he had taken time to understand why the vandalism was occurring and what underlying needs or frustrations it might represent. The investigation had revealed that the vandalism was being committed by teenagers who were expressing frustration with what they perceived as a lack of opportunities for creative expression and meaningful community involvement, working with business owners, city officials, and the teenagers themselves. Sergeant Torres had helped develop a public art program that channeled creative energy into projects that enhanced rather than damaged community spaces. Officer Sarah Thompson, who had studied community development in college, observed that this approach seemed to require skills that went beyond traditional law enforcement training. Sergeant Torres agreed, explaining that effective police work often involved serving as an informal social worker, mediator, community organizer, and educator, roles that required ongoing learning and professional development throughout an officer's career. The discussion continued with examples of how community policing had evolved over the decades of Sergeant Torres's service, as law enforcement had gradually shifted from a primarily reactive approach to one that emphasized prevention, relationship building, and collaborative problem solving. This evolution had required not just new techniques, but a fundamental change in how officers understood their role within communities. The new officers asked about the challenges of implementing community policing approaches in a society that often expected dramatic action and quick results from law enforcement. Sergeant Torres acknowledged that community policing could be less visible and immediate than traditional enforcement approaches, but he emphasized that it produced more sustainable improvements in community safety and quality of life. He shared examples of neighborhoods that had been transformed over time through patient, relationship building, and collaborative problem solving, creating conditions where crime prevention occurred naturally through social connections and mutual support, rather than through fear and formal control. These transformations had taken years to achieve, but they had created lasting changes that benefited entire communities while reducing the need for formal law enforcement intervention. The conversation moved to more personal territory as Sergeant Torres discussed how community policing had affected his own understanding of human nature and social relationships. Working closely with residents over many years had taught him to surface conflicts that brought people into contact with law enforcement to the deeper hopes and struggles that motivated most human behavior. Officer Maria Rodriguez asked about how to maintain professional boundaries while developing the kinds of personal relationships that seemed necessary for effective community policing. Sergeant Torres explained that successful community policing required a delicate balance between professional objectivity and genuine human connection, with officers learning to care deeply about community welfare while maintaining the emotional resilience necessary for dealing with difficult situations. The key, he suggested, was understanding that effective police work was ultimately about serving something larger than immediate law enforcement concerns. It was about contributing to the ongoing work of building and maintaining communities where people could live together peacefully despite their differences and the various challenges they faced. As darkness began to settle over the courtyard, Sergeant Torres shared stories from the most recent years of his career, when community policing approaches had become more sophisticated and comprehensive, incorporating insights from research on social psychology, community development, and conflict resolution. Modern police work, he explained, drew on knowledge from many fields while maintaining its fundamental focus on public service and community welfare. The new officers were particularly interested in hearing about restorative justice, programs that brought together offenders, victims, and community members to address criminal behavior through education and restitution rather than simply punishment. Sergeant Torres described several cases where these approaches had produced outcomes that were more satisfying for victims while also more effective in preventing future criminal behavior. One case involved a teenager who had been caught vandalizing school property, but who, through a restorative justice process, had been connected with a mentor program and had eventually become a peer educator, helping other young people avoid similar mistakes. The transformation had been possible because the restorative process had addressed underlying issues rather than simply imposing punishment for past behavior. Officer Jennifer Martinez asked about the emotional challenges of police work and how officers could maintain their compassion and effectiveness over long careers that inevitably exposed them to human suffering and social problems. Sergeant Torres acknowledged that police work could be emotionally demanding, but he emphasized that community policing approaches often provided more positive experiences and outcomes than traditional enforcement methods, working collaboratively with residents to address problems and build stronger communities created opportunities for officers to see the positive effects of their work while developing relationships that provided mutual support and understanding. Community policing, he suggested, could actually be less stressful than traditional approaches because it focused on prevention and problem solving rather than simply responding to crises after they occurred. The discussion continued with practical advice about how new officers could begin implementing community policing approaches in their assigned districts. Sergeant Torres emphasized the importance of spending time in communities during non-emergency periods, getting to know residents and business owners through casual conversation rather than only during crisis situations. Building trust and credibility within communities required consistency and patience, with officers demonstrating through their daily actions that they were committed to serving community welfare rather than simply enforcing rules. This process could take months or even years, but it created the foundation for the kind of collaborative relationships that made effective crime prevention possible. The new officers asked about specific techniques for conducting community engagement, and Sergeant Torres provided examples of successful approaches that had been developed over years of experimentation and refinement. Community walks, where officers spent time in neighborhoods during regular business hours, had proven particularly effective for building relationships while also gathering information about community concerns and resources. Regular attendance at community meetings, even when there were no immediate law enforcement issues to discuss, helped officers understand local dynamics and priorities while demonstrating their commitment to being genuine partners in community problem solving. These meetings also provided opportunities for residents to get to know officers as individuals rather than simply as representatives of law enforcement authority. The conversation moved to the broader social and political context within which police work occurred, acknowledging that law enforcement operated within larger systems of governance and social service that influenced both the problems officers encountered and the resources available for addressing them. Effective community policing required understanding these larger systems while working to improve coordination and cooperation among different agencies and institutions. Sergeant Torres emphasized that police officers were part of a larger network of professionals and institutions that shared responsibility for community welfare, including educators, healthcare providers, social workers, business leaders, and community organizations. Successful crime prevention often required coordination among all these different actors, with police serving as one important component of comprehensive community support systems. As the evening progressed, the discussion became more reflective, with Sergeant Torres sharing observations about how police work had changed over the course of his career and what he saw as the most important developments for the future of law enforcement. The increasing emphasis on community partnership and prevention represented, in his view, a return to older traditions of policing that had been temporarily displaced by more militaristic approaches. The new officers were interested in understanding how they could contribute to continued progress toward more effective and humane approaches to law enforcement while also managing the practical challenges of daily police work. Sergeant Torres encouraged them to think of their careers as opportunities for ongoing learning and professional development, with each interaction providing chances to refine their understanding and improve their effectiveness. The mentoring session concluded with Sergeant Torres offering his personal commitment to continued support and guidance as the new officers began their careers. He provided his contact information and encouraged them to reach out whenever they encountered situations that required additional perspective or resources, understanding that effective police work often required collaboration and consultation with more experienced colleagues. The new officers thanked Sergeant Torres for sharing his wisdom and experience, recognizing that they had received something precious. Not just technical knowledge about police procedures, but deeper understanding about the purpose and potential of law enforcement work when it was conducted with patience, compassion, and genuine commitment to community service. As they walked back toward the academy building, the new officers carried with them not just the specific stories and advice that Sergeant Torres had shared, but a broader understanding of police work as a calling that required constant attention to human dignity and community welfare. They understood that their success would be measured not just in arrests made or cases closed, but in relationships built, problems prevented, and communities strengthened through their service. The next morning would bring the beginning of their field training, where they would begin applying the principles and approaches they had learned during their academy training. But they would carry with them the understanding that effective police work was ultimately about serving something larger than immediate law enforcement concerns. It was about contributing to the ongoing human project of creating communities where safety emerged from mutual care and understanding, rather than fear and control. In the quiet darkness of the academy courtyard, where wisdom had been passed from one generation to the next, the future of community policing rested in capable hands that had been prepared not just with technical skills but with the deeper understanding that would guide them through careers dedicated to serving their communities with patience, compassion, and unwavering commitment to justice achieved through understanding rather than force. Asterisk. The Emergency Communications Center had monitored the Riverside District for 23 years, its banks of radio equipment and computer terminals serving as the electronic nervous system that connected residents in crisis with the help they needed. Dispatcher Patricia Holloway had worked this sector longer than anyone, developing an almost intuitive understanding of how community needs changed over time and how the nature of emergency calls could reveal deeper patterns in neighborhood health and social cohesion. On this particular Tuesday evening in late autumn, Patricia found herself reviewing call logs from the past 5 years, documenting a remarkable transformation that had occurred so gradually that its full significance was only now becoming apparent. The Riverside District, once one of the busiest areas for emergency response, had experienced a steady decline in calls that reflected not neglect or underreporting, but genuine improvement in the community's capacity to address problems before they required official intervention. The transformation had begun almost imperceptibly, with small changes in the types of calls the center received and the outcomes that resulted from emergency responses. Traditional domestic disturbance calls had gradually been replaced by requests for mediation services, with families learning to access help before conflicts escalated to levels requiring police intervention. Patricia remembered the Morrison family on Elm Street, whose regular domestic disputes had generated multiple emergency calls during the late 1990s. The last call from that address had been 3 years ago, when Mrs. Morrison had contacted dispatch not to report a crisis, but to request information about counseling services that she and her husband could access voluntarily to improve their communication and conflict resolution skills. The center's computer records showed that the Morrisons had successfully completed a community mediation program and had subsequently become volunteer mediators themselves, helping other families address conflicts before they became emergencies. Their transformation from frequent emergency callers to community resources exemplified the broader changes that had occurred throughout the district. Similar patterns appeared in other categories of emergency calls. Reports of suspicious activity had declined significantly, not because residents were less vigilant, but because improved neighborhood communication had reduced the number of situations where legitimate activities were misunderstood as potential threats. Community meetings and informal social networks had created opportunities for residents to know each other well enough to distinguish between normal activities and genuine causes for concern. Patricia pulled up records from the Chun household on Maple Street, where elderly Mrs. Chun had once called regularly for welfare checks when she was concerned about neighbors who seemed isolated or in distress. The records showed that these calls had evolved over time, with Mrs. Chun learning to coordinate informal neighborhood support networks that could address many concerns without requiring official emergency response. The most recent entry in Mrs. Chun's file was not an emergency call, but a thank you note she had sent to the dispatch center, expressing appreciation for the patient assistance she had received over the years, while announcing that she had organized a neighborhood volunteer program that could handle most of the situations that had previously required emergency calls. The youth-related calls that had once been common in the district had also declined dramatically, reflecting successful implementation of mentorship and engagement programs that provided positive outlets for young people's energy while building connections between different generations within the community. Patricia remembered when Friday and Saturday nights had brought regular calls about teenage vandalism, noise complaints, and minor conflicts that reflected broader problems of social isolation and lack of meaningful opportunities for young people. The last significant youth-related incident had occurred 18 months earlier, when a group of teenagers had been caught spray painting designs on a retaining wall near the community park. Rather than generating criminal charges or ongoing conflicts, the incident had led to a community art project that had transformed the retaining wall into a neighborhood gathering place where residents regularly organized events and activities. Patricia had been the dispatcher who had taken the initial call about the spray painting, and she had watched through follow-up reports as the situation had evolved from a potential law enforcement problem into a community organizing success story. The teenagers had become leaders in organizing activities for younger children, while the retaining wall had become a symbol of how conflicts could be transformed into opportunities for positive community development. The emergency medical calls from the district had also changed character over time, with fewer crisis situations and more requests for information about preventive services and health resources. The community had developed informal networks of support for elderly residents that had reduced the number of emergency situations while improving overall health outcomes through early intervention and ongoing assistance. One case that particularly impressed Patricia involved Mr. Rodriguez on Oak Street, whose diabetes management had once generated frequent emergency calls when his blood sugar levels became dangerously unstable. Community volunteers had learned to provide regular check-ins and medication reminders that had prevented most emergency situations while helping Mr. Rodriguez maintain his independence and dignity. The center's records showed that Mr. Rodriguez had not required emergency medical transport in over 2 years, and his file contained letters from his physician documenting improved health outcomes that had resulted from the consistent community support he had received. His case had become a model for similar programs that had been developed for other residents with chronic health conditions. The business district within the Riverside area had also experienced significant changes that were reflected in emergency call patterns. Reports of shoplifting, vandalism, and other property crimes had declined as business owners had learned to work collaboratively with community organizations to address underlying causes of criminal behavior, rather than simply responding to its symptoms. Patricia remembered the Rodriguez family market on 5th Street, which had once generated weekly calls about shoplifting incidents. The store owners had worked with community leaders to understand that many of the incidents involved families struggling with food insecurity, leading to the development of a community food sharing program that had virtually eliminated theft while building stronger relationships between the business and its customers. The market had become a community resource center that provided information about social services and job opportunities, while continuing to serve as a neighborhood gathering place where residents could maintain the informal connections that contributed to community safety and mutual support. Even the center's interactions with city services had evolved, with fewer emergency repairs and more planned maintenance that reflected improved communication between residents and municipal departments. The community had learned to identify and report infrastructure problems before they became emergencies, while city departments had become more responsive to community concerns and more effective at coordinating preventive maintenance. Patricia reviewed reports from the Public Works Department showing that the Riverside District now had some of the best maintained infrastructure in the city, with residents taking active roles in monitoring and maintaining public spaces, while working collaboratively with city staff to address problems before they affected community safety or quality of life. The transformation had not been accomplished through any single program or intervention, but through the accumulated effects of hundreds of small improvements in communication, cooperation, and community problem-solving capacity. Residents had learned to address conflicts and challenges through informal networks of mutual support, while institutions had learned to provide resources and assistance in ways that strengthened, rather than undermined, community capacity for self-help. Patricia had observed how this transformation had affected not just the quantity of emergency calls, but their quality and outcomes. When emergency response was needed, it occurred within a context of community support and engagement that made interventions more effective, while reducing the likelihood of future crises. One recent example involved a domestic situation that had required police intervention when a couple's argument had escalated beyond their ability to manage alone. However, the response had occurred within a neighborhood where other residents knew the family well and could provide ongoing support and assistance that addressed underlying stresses while helping the couple develop better conflict resolution skills. The follow-up reports showed that the incident had become an opportunity for community learning and support rather than simply a law enforcement matter. The couple had received counseling and mediation assistance, while their neighbors had organized practical help with childcare and financial planning that had reduced the stress factors that had contributed to their conflict. As Patricia continued reviewing the call logs, she began to understand that she was documenting something remarkable in the history of emergency services. A community that had learned to prevent most emergencies through the patient work of building relationships, sharing resources, and addressing problems collaboratively before they required outside intervention. The Riverside District had not eliminated human problems or conflicts, but it had developed the capacity to address most of them through community resources and informal support networks that were more effective and sustainable than formal emergency services alone could provide. The evening shift was quiet, with only routine calls that were handled efficiently and effectively through the established networks of communication and cooperation that had been developed over years of community building. Patricia found herself with time for reflection on how emergency services could best support communities that were developing their own capacity for problem solving and mutual assistance. Role of emergency dispatch was evolving from crisis response toward community resource coordination, with dispatchers serving as links between formal services and informal support networks that could address many problems more effectively than traditional emergency response. This evolution required new skills and understanding, but it also provided opportunities for more satisfying and effective public service. Patricia had begun training other dispatchers in community resource coordination, helping them understand how to connect callers with appropriate informal and formal assistance while supporting the development of community capacity rather than creating dependency on outside intervention. The training emphasized the importance of understanding community assets and resources, recognizing when situations could be addressed through informal support rather than formal emergency response, and facilitating connections between residents who needed assistance and neighbors who could provide help. As her shift concluded, Patricia reflected on how much emergency services had changed during her career and how much more change would be necessary as communities continued developing their capacity for self-help and mutual support. The future of emergency services would likely involve less crisis response and more community resource coordination, with professional responders serving as partners with community networks rather than outside experts who took over during emergencies. The Riverside District represented a glimpse of this future, where emergency services remained available when needed, but where most problems were addressed through community resources and informal support networks that had been consciously developed and maintained over time. Patricia gathered her reports and prepared to brief the incoming night shift, knowing that her documentation of the Riverside transformation would contribute to broader understanding of how communities could develop resilience and self-sufficiency while maintaining appropriate connections to professional services when they were needed. RADIO equipment that had once carried constant emergency calls from the Riverside District now monitored a community that had learned to solve most of its problems through patience, understanding, and mutual support. The quiet radio represented not the absence of community life, but its maturation into forms that required less formal intervention while providing more sustainable solutions to the challenges that all communities faced. In the peaceful silence of the Emergency Communications Center, surrounded by equipment that stood ready to provide assistance when needed, but that increasingly monitored communities capable of helping themselves, Patricia felt the deep satisfaction that came from witnessing the success of patient community building that had transformed emergency response from crisis management into resource coordination and mutual support. The police department's memorial garden had been designed as a place where officers could reflect on the meaning of their service, its winding paths and carefully tended flower beds, creating an atmosphere of peaceful contemplation that encouraged thoughtful consideration of the profound responsibilities that came with wearing the badge. Captain Robert Hayes, now 62 years old with 38 years of service, had requested this setting for his retirement reflection, understanding that the end of his formal police career marked not a conclusion, but a transition to different forms of community service. The morning sun filtered through the memorial garden's mature trees, casting gentle patterns of light and shadow that seemed to shift with the rhythm of quiet breathing. Captain Hayes walked slowly along the main path, pausing occasionally to read the inscriptions on memorial stones that honored officers who had served with distinction while dedicating their lives to the protection and welfare of the community. His own career had spanned a remarkable period of transformation in law enforcement, from the traditional reactive approaches of the early 1980s through the development of comprehensive community policing, strategies that had revolutionized how police departments understood their role within democratic society. He had been privileged to participate in and help guide this evolution, contributing to changes that had made communities safer while also making police work more satisfying and effective. The garden's central memorial honored all officers who had served the community with dedication and integrity. Its simple inscription reading "In service to others," words that captured the essential spirit of police work when it was conducted with proper understanding of its purpose and potential. Captain Hayes had tried to embody this spirit throughout his career, understanding that effective law enforcement was ultimately about serving something larger than immediate crime control concerns. He reflected on his early years as a patrol officer, when he had gradually learned that the most important aspects of police work often occurred during quiet moments between emergency calls, when officers had opportunities to build relationships with residents and develop understanding of community dynamics that could prevent problems before they required formal intervention. One of his first assignments had been the Riverside District, where he had learned the patient art of community engagement through daily interactions with residents who had taught him more about effective police work than any academy training could provide. Mrs. Chun on Maple Street had been one of his most important teachers, showing him how longtime residents could serve as informal community leaders who understood local needs and resources better than outside professionals. Mrs. Chun had introduced him to the concept of community wisdom, the accumulated understanding that developed over time through sustained engagement with neighborhood life and careful attention to how different families and individuals contributed to the larger social fabric. This wisdom could not be learned from textbooks or training manuals, but required patient observation and genuine respect for the knowledge that residents possessed about their own circumstances. Captain Hayes had applied these lessons throughout his career, developing approaches to police work that emphasized partnership with community members rather than top-down enforcement of externally imposed rules. He had learned to see residents as colleagues in the work of maintaining community safety, rather than passive recipients of police services or potential sources of problems requiring official control. The garden's meditation area contained benches, arranged to encourage quiet reflection while providing views of the surrounding community that officers served. Captain Hayes settled onto one of these benches, observing the familiar sights and sounds of the neighborhood that surrounded the police station, understanding that his formal relationship with this community was ending, but that his commitment to its welfare would continue in different forms. His career had included many memorable cases, but the ones he valued most were those where patient police work had helped transform conflicts into opportunities for community building and mutual understanding. The Morrison family domestic situation had been one such case, requiring multiple visits over several months, while the family worked to address underlying problems that had been creating stress and conflict. The resolution had not involved arrests or formal legal proceedings, but rather careful coordination of social services, family counseling, and community support that had addressed the root causes of the family's difficulties while strengthening their capacity to handle future challenges independently. Years later, the Morrison family had become community volunteers who helped other families navigate similar difficulties. Captain Hayes had learned that this kind of comprehensive intervention, while time-intensive and sometimes requiring months to achieve lasting results, was far more effective than traditional enforcement approaches in preventing future problems, while building community resilience and social cohesion. Another case that had shaped his understanding involved a series of property crimes in the downtown business district that had been resolved through collaborative problem-solving rather than traditional investigative techniques. Working with business owners, community organizations, and the individuals who had been committing the crimes, Captain Hayes had helped develop a comprehensive response that addressed both immediate safety concerns and underlying social conditions that had been contributing to criminal behavior. The solution had involved creating legitimate employment opportunities for people who had been supporting themselves through illegal activities, while also improving security and community engagement in ways that made criminal activity less attractive and more difficult. The process had taken nearly a year to implement fully, but it had produced lasting improvements that had benefited the entire community. These experiences had taught Captain Hayes that effective police work often required thinking beyond immediate law enforcement concerns toward broader questions of community development and social justice. Crime prevention was most successful when it addressed underlying causes rather than simply responding to symptoms, requiring police to work collaboratively with other agencies and institutions that shared responsibility for community welfare. The gardens historical markers documented the evolution of police work in the community over several decades, showing how approaches to law enforcement had gradually shifted from primarily reactive strategies toward more comprehensive prevention and community engagement efforts. Captain Hayes had been proud to contribute to this evolution, helping to develop and implement policies that had made police work more effective while also more humane and respectful of community needs. His role in developing the department's community policing training program had been one of his most satisfying accomplishments, creating educational opportunities that helped officers understand their work as community service rather than simply law enforcement. The training emphasized communication skills, cultural competency, and collaborative problem-solving techniques that enabled officers to work more effectively with diverse communities while building trust and mutual respect. The program had been adopted by other departments throughout the region, contributing to broader improvements in police-community relations while demonstrating that effective law enforcement could be achieved through partnership and understanding rather than authority and force. Captain Hayes had provided consultation to dozens of other communities that had wanted to implement similar approaches, sharing lessons learned while helping them adapt successful strategies to their own unique circumstances. The Garden's Peace Memorial honored officers who had served during periods of social conflict, reminding viewers that police work at its best contributed to peaceful resolution of disputes rather than escalation of tensions. Captain Hayes had served during several challenging periods when community tensions had required careful attention to maintaining order while also protecting democratic rights and encouraging constructive dialogue. His approach had emphasized de-escalation and mediation rather than force, working to understand different perspectives while helping conflicting parties find common ground and shared solutions. This work had been demanding and sometimes dangerous, but it had produced outcomes that had strengthened rather than divided communities while demonstrating that effective law enforcement could support rather than undermine democratic values. As the morning progressed, Captain Hayes was joined by other officers who wanted to share their appreciation for his service and learn from his experience before his formal retirement. These conversations provided opportunities for him to pass on insights and wisdom that could only be gained through decades of patient community engagement and careful attention to the human dimensions of police work. Officer Jennifer Martinez, who had recently graduated from the academy, asked about the personal qualities that were most important for effective community policing. Captain Hayes emphasized the importance of genuine curiosity about people and communities, patience with complex problems that could not be solved quickly, and humility about the limitations of what police could accomplish without community partnership and support. Detective Michael Torres, who had worked with Captain Hayes on several community development projects, asked about strategies for maintaining hope and effectiveness during periods when social problems seemed overwhelming or resistant to intervention. Captain Hayes acknowledged that police work could be emotionally challenging, but he emphasized that community policing approaches often provided more opportunities for positive outcomes and meaningful relationships than traditional enforcement methods. The key, he suggested, was understanding that individual officers were part of a larger network of people and institutions working toward community improvement. with progress measured not just in immediate outcomes, but in the gradual development of social conditions that made positive change possible over time. The conversation continued with discussion of how police work was likely to continue evolving, with increasing emphasis on prevention and community partnership while maintaining readiness to respond effectively when traditional law enforcement intervention was necessary. Captain Hayes expressed optimism about the future of policing, believing that younger officers were better prepared than previous generations to work collaboratively with diverse communities while addressing complex social problems. As the retirement gathering concluded, Captain Hayes expressed gratitude for the opportunity to have served the community while learning from residents who had taught him important lessons about human nature, social relationships, and the possibilities for positive change when people work together with patience and understanding. His retirement would not mean an end to community service, but rather a transition to different forms of engagement that could draw on the experience and relationships he had developed during his police career. He planned to continue working with community organizations, mentoring young people, and supporting initiatives that addressed underlying causes of social problems while building community capacity for self-help and mutual support. The Memorial Garden would remain a place where he could come for reflection and renewal, understanding that the principles and relationships that had guided his police work would continue to be relevant in whatever forms of service he pursued in the future. As he prepared to leave the garden for the final time as an active police officer, Captain Hayes felt deep satisfaction in knowing that his career had contributed to positive changes that would continue to benefit the community long after his retirement. The work of building safe, just, and caring communities was never finished, but each generation of dedicated public servants could contribute to progress that would make life better for future generations. The paths through the Memorial Garden led in many directions, symbolizing the various ways that people could serve their communities while maintaining shared commitment to the values of justice, compassion, and mutual respect that made democratic society possible. Captain Hayes chose the path that led toward the community he had served with dedication for nearly 4 decades, understanding that his formal police career was ending, but that his commitment to community welfare would continue in whatever form seemed most useful and appropriate. In the peaceful beauty of the Memorial Garden, surrounded by tributes to others who had devoted their lives to community service, Captain Hayes carried with him the deep satisfaction that came from a career spent in service to others, along with the understanding that some kinds of service never truly ended, but simply transformed into new opportunities for contributing to the ongoing work of building human communities where safety, justice, and compassion could flourish together. The Archive of Completed Wisdom stood at the heart of the city like a cathedral of human understanding, its vast halls containing not just the documented cases and resolved conflicts that had shaped decades of community life, but something more precious: the accumulated learning that transformed individual experiences into collective wisdom that could guide future generations toward more effective and compassionate approaches to the eternal challenges of living together in peace. Chief Archivist Elizabeth Chun, now in her 42nd year of service to the institution, moved through the archive's highest tower with the quiet reverence that came from understanding she was the keeper of humanity's most important treasures. The stories of how communities had learned to transform conflict into cooperation, violence into understanding, and fear into the kind of trust that made democratic life possible. The tower room faced east toward the sunrise, its windows designed to capture the first light of each new day as it illuminated the city spread below. From this vantage point, Elizabeth could see the neighborhoods, schools, businesses, and public spaces where all the stories contained in the archive had unfolded. where countless individuals had chosen patience over haste, understanding over judgment, and collaboration over domination in the daily work of building community safety through relationship rather than force. The archive contained millions of individual cases, each one representing a moment when the principles of restorative justice, community engagement, and collaborative problem-solving had been applied to specific human situations. But Elizabeth understood that the true value of the collection lay not in the individual stories, but in the patterns that emerged when thousands of cases were considered together, revealing the underlying principles that made peaceful conflict resolution possible across different circumstances and communities. She began her morning meditation with the earliest cases, documents from an era when police work was just beginning to evolve beyond simple law enforcement toward the more comprehensive community service that had eventually transformed how society understood public safety and social order. These early cases showed the tentative first steps toward approaches that would eventually become standard practice, with individual officers experimenting with new methods of engagement and problem solving that addressed underlying causes rather than just immediate symptoms. Asterisk. The Morrison juvenile vandalism case from 1967 remained one of her favorites, not because it was dramatic or complex, but because it demonstrated how a single officer's willingness to understand rather than simply punish had created ripple effects that had influenced community development for decades. Detective Robert Morrison's patient work with the teenagers who had been spray painting buildings had led to the creation of the first community art program, which had eventually evolved into a comprehensive youth development initiative that had prevented countless future problems, while building positive relationships between different generations within the community. The case file contained photographs spanning 30 years, showing how the original graffiti site had been transformed into a community gathering place, where residents regularly organized cultural events and educational programs. The teenagers who had once been viewed as problems requiring law enforcement intervention had become community leaders who mentored younger people while contributing their skills and energy to neighborhood improvement projects. Elizabeth moved through the archive sections chronologically, observing how approaches to community policing had gradually become more sophisticated and comprehensive over time. The 1970s cases showed increased emphasis on family intervention and social service coordination, with officers learning to address domestic situations through counseling and resource referrals rather than simply responding to immediate crises. The Chun family domestic mediation case exemplified this evolution, documenting Officer Patricia Chun's patient work with a family experiencing conflicts related to economic stress and communication problems. The intervention had required monthly visits over nearly a year, during which Officer Chun had helped family members develop conflict resolution skills while connecting them with resources that addressed underlying causes of their difficulties. The final documents in the Chen case file included letters written decades later by family members who had become community volunteers, using the skills they had learned during their own crisis to help other families navigate similar challenges. Their transformation from service recipients to service providers illustrated how effective intervention could create lasting positive changes that benefited entire communities rather than just individual families. The 1980s archives showed the emergence of comprehensive community policing strategies that integrated law enforcement with economic development, educational programs, and social services. The Riverside District Transformation Project had become a model for similar initiatives throughout the country, demonstrating how sustained community engagement could address multiple social problems simultaneously while building resident capacity for ongoing self-help and mutual support. Elizabeth pulled the comprehensive final report from the Riverside Project, a document that had influenced policy development in hundreds of other communities. The report documented dramatic improvements in crime statistics, economic indicators, educational outcomes, and resident satisfaction that had resulted from 3 years of intensive community organizing and collaborative problem solving. However, Elizabeth understood that the statistics only partially captured the transformation that had occurred. The real success was evident in the social relationships and community institutions that had been created through the process, providing sustainable foundations for continued progress that did not depend on ongoing external support or intervention. The 1990s archives contained extensive documentation of restorative justice programs that had brought together offenders, victims, and community members to address criminal behavior through education and restitution rather than simply punishment and incarceration. These programs had produced outcomes that were more satisfying for victims, while also more effective in preventing future criminal behavior, demonstrating that approaches based on understanding and healing could be more successful than those based on deterrence and retribution. The Rodriguez burglary case remained one of the most compelling examples of restorative justice success, showing how a teenager who had been stealing from elderly neighbors had been transformed into a community leader through a process that addressed underlying causes of his behavior while providing opportunities for positive contribution to neighborhood life. The case file contained documentation spanning 15 years, showing how the young man had completed his education, developed stable employment, and eventually become a social worker who specialized in helping other young people avoid criminal involvement. His transformation had been possible because the restorative process had treated him as a whole person with potential for positive change rather than simply as an offender requiring punishment. Elizabeth continued through the archives of the 2000s and 2010s, observing how community policing had evolved to incorporate insights from research on social psychology, community development, and conflict resolution. Modern police work drew on knowledge from many fields, while maintaining its fundamental focus on public service and community welfare, creating approaches that were both more effective and more humane than traditional law enforcement methods. The most recent cases showed remarkable sophistication in addressing complex social problems through comprehensive interventions that involved multiple agencies and community organizations working together toward shared goals. The Gang Intervention Program had become particularly successful, addressing youth violence through approaches that provided alternative opportunities for belonging and purpose while addressing underlying social and economic conditions that made gang involvement attractive. Program's success was documented not just in reduced violence statistics, but in the academic achievements, career developments, and community contributions of young people who had been redirected from destructive to constructive activities. Many had become mentors and community leaders themselves, creating positive cycles that continued to benefit new generations of young people. As Elizabeth reached the archive's most recent acquisitions, she found herself reviewing cases that demonstrated the full maturation of community policing approaches that had been developing for decades. Communities had learned to prevent most problems through proactive engagement and collaborative problem solving, with formal law enforcement serving as one component of comprehensive support systems rather than the primary response to social difficulties. The past of the justified systems rather than the primary response to social difficulties. Futures Planning Office reports showed how communities could address emerging challenges before they became crises, with early intervention systems that identified and responded to social stresses before they manifested as criminal behavior or community conflict. This approach represented the ultimate evolution of crime prevention, addressing problems at their roots rather than waiting to respond to their symptoms. Elizabeth understood that she was witnessing something unprecedented in human history: the development of systematic approaches to community safety that emphasized prevention, relationship building, and collaborative problem solving rather than force and punishment. The archive contained evidence that such approaches were not just idealistic dreams but practical realities that had been successfully implemented in countless communities. The transformation had not been easy or automatic, requiring sustained commitment from many people over many years. But the evidence was clear. Communities could learn to address their problems through understanding and cooperation rather than conflict and domination, creating conditions where crime became unnecessary and unacceptable, rather than simply illegal and punishable. As the morning progressed, Elizabeth was joined by researchers and policymakers who had come to study the archive's contents, seeking insights that could be applied in their own communities and institutions. These visitors came from around the world, representing governments, universities, and community organizations that were working to implement more effective and humane approaches to public safety and social order. The archive had become a center for learning and innovation, with scholars and practitioners collaborating to understand how successful community policing strategies could be adapted to different cultural contexts and social conditions. The knowledge contained in the archive was not just historical documentation but living wisdom that continued to influence contemporary efforts to build safer and more just communities. Elizabeth had developed educational programs that helped visitors understand the principles underlying successful community policing while providing practical guidance for implementation in their own contexts. These programs emphasized that specific techniques were less important than underlying commitments to treating all community members with dignity and respect while addressing problems through collaborative problem solving rather than top-down control. The archive's research library contained studies documenting the spread of community policing approaches throughout the country and around the world, showing how local innovations had influenced broader changes in how societies understood the relationship between law enforcement and community welfare. The transformation was ongoing, with new communities regularly implementing programs based on principles that had been developed and refined over decades of experimentation and learning. As afternoon settled over the archive, Elizabeth climbed to the tower's highest level, where the original vision statements and founding documents of the community policing movement were preserved in cases designed to protect them for future generations. These documents captured the hopes and aspirations of people who had believed that law enforcement could be transformed from a primarily punitive enterprise into a comprehensive community service that addressed underlying causes of social problems while building stronger, more resilient communities. The vision had been largely realized, with community policing approaches becoming standard practice in most departments, while crime rates had declined to historic lows and community satisfaction with police services had reached unprecedented levels. More importantly, communities had developed the capacity to address most of their problems through informal networks of mutual support and collaborative problem solving, with formal intervention required only in exceptional circumstances. From the tower's windows, Elizabeth could see the city spread out in the late afternoon light, its neighborhoods filled with families and individuals who lived their daily lives with confidence that their communities provided both safety and opportunity for positive engagement. The transformation that had been documented in the archive's millions of cases had created the foundation for this peaceful prosperity, demonstrating that human beings could indeed learn to live together harmoniously when they committed themselves to the patient work of building understanding and trust. As evening approached, Elizabeth conducted her final review of the day's acquisitions. New cases that continued the eternal human story of conflict and resolution. Problem and solution, challenge and opportunity. Each new case added to the archive's comprehensive record of how communities could address their difficulties through patience, creativity, and genuine commitment to the welfare of all residents. The archive would continue to grow, preserving the wisdom gained through countless individual experiences, while making that wisdom available to future generations who would face their own unique challenges and opportunities. The stories contained within these walls would continue to provide guidance and inspiration for anyone who needed to understand that effective responses to human problems were possible when communities committed themselves to the principles of justice, compassion, and mutual respect. In the peaceful silence of the Archive of Completed Wisdom, surrounded by millions of stories that documented humanity's gradual learning of how to live together in peace, Elizabeth felt the deep satisfaction that came from preserving evidence of the human capacity for positive change and collective wisdom. The final page of the final report had settled into place, but it represented not an ending but a moment of rest in the eternal story of human community, where each resolution became the foundation for future learning. Each act of understanding contributed to collective wisdom, and each peaceful conclusion opened space for new opportunities to demonstrate that justice achieved through compassion was not just possible but inevitable. When people chose patience over haste, understanding over judgment, and love over fear in the endless work of building communities where all could flourish together in safety, dignity, and peace. The Community Wisdom Center had emerged organically from the success of the Archive of Completed Wisdom, occupying a series of interconnected gardens and pavilions where the boundary between indoor and outdoor spaces seemed to dissolve into something more fluid and natural. Dr. Sarah Chun, granddaughter of the legendary community organizer Mrs. Eleanor Chun, had been invited to serve as the center's first director of living wisdom. Tasked with understanding how the accumulated knowledge of decades of community building could continue to evolve and adapt to serve future generations, the center's design reflected its purpose, with flowing spaces that encouraged both solitude and gathering, contemplation and collaboration. Morning light filtered through carefully positioned skylights and windows, creating an atmosphere where thought could develop naturally, like plants growing toward the sun. The sound of water moving through small streams and fountains provided a constant, gentle background that seemed to encourage the kind of deep listening that allowed new insights to emerge from familiar wisdom. Sarah had spent the early morning hours in the center's reflection garden, reviewing reports from communities around the world that had implemented approaches based on the archived wisdom of community policing and restorative justice. These reports painted a picture of global transformation that was both inspiring and humbling, showing how principles developed in one small city had influenced the creation of more peaceful and just societies in countless different cultural contexts. The Tokyo Neighborhood Harmony Project had adapted community policing principles to create networks of mutual support that had virtually eliminated crime in several districts while strengthening traditional Japanese values of collective responsibility and social cooperation. The project's success had been documented through 5 years of careful research that showed how ancient cultural wisdom could be combined with modern community building techniques to create uniquely effective approaches to social harmony. Similar adaptations had emerged in communities throughout Africa, where traditional conflict resolution practices had been combined with contemporary restorative justice approaches to create systems that addressed both individual crimes and community healing. The Ubuntu Community Justice Program in South Africa had become a model for post-conflict societies, seeking to build peace through understanding rather than retribution. European cities had developed their own variations, with the Amsterdam Neighborhood Circle program, creating networks of resident mediators who could address conflicts before they required formal intervention. The program had been so successful that it had been adopted throughout the Netherlands and was being studied for implementation in other countries facing similar urban challenges. Sarah found herself particularly intrigued by reports from indigenous communities that had long practiced forms of restorative justice that were now being recognized as sophisticated approaches to community healing that mainstream society could learn from. The Maori justice circles in New Zealand had influenced the development of family group conferencing that was now used worldwide, while Native American peacemaking traditions were being studied by conflict resolution specialists seeking more effective approaches to healing community wounds. The center's main hall contained a living exhibit that showed how community policing and restorative justice approaches were continuing to evolve, with new innovations emerging as communities adapted basic principles to address contemporary challenges. Climate change, technological disruption, and global migration were creating new forms of social stress that required creative responses based on established principles of community engagement and collaborative problem solving. One display showed how communities in Bangladesh had developed flood response networks that combined disaster preparedness with crime prevention, recognizing that natural disasters often created conditions that could lead to increased social conflict if not addressed through proactive community organizing. The networks had proven remarkably effective at maintaining social cohesion during difficult periods while also building community capacity for addressing other challenges. Asterisk. Another display documented urban farming projects in Detroit that had transformed abandoned lots into community gardens while also creating economic opportunities and social connections that had reduced crime and increased neighborhood stability. The projects had demonstrated how environmental restoration and community building could be combined to address multiple social problems simultaneously. The center's research library contains studies showing how digital technologies were being used to enhance rather than replace traditional community building approaches. Online platforms had been developed to facilitate neighborhood communication and resource sharing, while social media was being used to organize community events and coordinate mutual aid networks. However, Sarah had observed that the most successful technological applications were those that strengthened face-to-face relationships rather than substituting for them. Virtual tools were most effective when they supported and enhanced in-person community activities, creating new opportunities for connection while preserving the kind of deep personal relationships that formed the foundation of community safety and resilience. The afternoon brought Sarah's favorite part of her work, facilitating conversations between community leaders from different countries and cultures who were sharing experiences and learning from each other's approaches to building peaceful and just communities. Today's session included representatives from 12 countries who were working on various aspects of community development and conflict prevention. The conversation began with presentations from each participant about their current projects and challenges, revealing both the diversity of approaches being used around the world and the underlying principles that seem to be universal across different cultural contexts, whether in rural villages or urban neighborhoods. Successful community building required patient attention to relationship development, inclusive decision-making processes, and comprehensive approaches that addressed underlying causes rather than just immediate symptoms. Asterisk. A representative from rural Kenya described how traditional Council of Elders approaches had been adapted to include women, young people in community decision-making, while maintaining respect for cultural wisdom and established authority structures. The adapted councils had proven effective at preventing conflicts related to land use and resource allocation, while also addressing domestic violence and other issues that had previously been difficult to discuss openly. Participants from urban Brazil shared experiences with community police units that had transformed favelas from areas of high violence into neighborhoods where residents felt safe to organize cultural events and economic development projects. The transformation had required several years of sustained engagement, but it had produced remarkable improvements in both safety and quality of life that had attracted national and international attention. The representative from rural Montana discussed how ranching communities had developed mediation services that could address property disputes and family conflicts before they escalated to levels requiring legal intervention. The services had been particularly effective because they were provided by trained community members who understood local culture and values rather than outside professionals who might not appreciate the nuances of rural life. As the conversation continued, Sarah observed how each community had developed its own unique variation of basic principles while maintaining core commitments to inclusive participation, restorative rather than punitive responses to problems, and comprehensive approaches that addressed underlying causes of social difficulties. The diversity of specific applications demonstrated that community building was both an art and a science, requiring creativity and cultural sensitivity, while also following established principles of effective social organization. The session concluded with participants identifying common challenges they were facing and discussing potential collaborative responses that could draw on resources and expertise from multiple communities. Climate change adaptation, youth engagement, and elder care emerged as areas where communities could benefit from sharing knowledge and developing coordinated approaches to challenges that transcended local boundaries. Sarah had been developing what she called wisdom networks that could facilitate ongoing communication and collaboration between communities that were working on similar challenges while respecting the autonomy and cultural integrity of each local context. These networks operated through both digital platforms and periodic in-person gatherings that allowed for the kind of deep relationship building that was necessary for meaningful collaboration. The evening brought Sarah's work with the Center's Youth Wisdom Council, a group of young people from around the world who were studying traditional community building approaches while developing innovations that could address contemporary challenges. The council met monthly through video conferences while organizing annual gatherings that brought together emerging leaders who were committed to building more peaceful and just communities. Tonight's session focused on mental health and community wellness, exploring how traditional healing practices could be integrated with modern therapeutic approaches to create comprehensive support systems that addressed individual needs while strengthening community connections. The discussion revealed remarkable creativity and insight among young people who understood both the value of ancestral wisdom and the need for adaptation to contemporary circumstances. Participant from New Zealand described how Maori healing practices were being integrated with Western psychology to create culturally appropriate mental health services that addressed both individual trauma and community healing. The integrated approaches had proven more effective than either traditional or modern methods alone, suggesting that the future of mental health care might require combining wisdom from multiple cultural traditions. A representative from India discussed how ancient meditation and mindfulness practices were being adapted for use in conflict resolution and community building, creating approaches that help people develop the emotional regulation and empathy skills that were necessary for effective collaboration. The practices had been particularly useful in addressing intergenerational conflicts and helping communities navigate rapid social change. The Youth Wisdom Council was also working on projects that addressed emerging challenges such as online harassment, social media addiction, and the social isolation that could result from excessive dependence on digital technologies. Their approaches emphasized building stronger offline communities that could provide the kind of meaningful relationships and social support that reduced vulnerability to online problems. As the session concluded, Sarah reflected on how the center's work represented something unprecedented in human history, a systematic effort to gather, preserve, and share wisdom about community, building across cultural boundaries while respecting the unique characteristics that made each community special. The center was both a repository of accumulated knowledge and a laboratory for developing new approaches that could address emerging challenges. The work was never finished because communities were constantly evolving and facing new situations that required creative responses based on established principles. However, the center's growing network of collaborating communities provided evidence that human beings could indeed learn to live together peacefully when they committed themselves to the patient work of building understanding and trust across all the differences that had historically divided them. Sarah prepared to close the center for the evening, understanding that tomorrow would bring new opportunities to facilitate learning and collaboration between communities that were working to create more peaceful and just societies. The wisdom contained in the center's archives and research collections would continue to grow, enriched by the experiences of communities around the world that were demonstrating daily that alternatives to violence and domination were not just possible but practical. In the gentle twilight that settled over the Community Wisdom Center, where ancient wisdom met contemporary innovation in an endless dance of learning and growth, Sarah felt the deep satisfaction that came from participating in humanity's ongoing evolution toward forms of social organization that honored the dignity and potential of every person while creating conditions where all could flourish together in safety, justice, and peace. The work would continue tomorrow and the day after that, as communities everywhere contributed their own experiences and insights to the growing understanding of how human beings could create societies based on cooperation rather than competition, understanding rather than fear, and love rather than power in the endless human project of building heaven on earth through patient attention to the sacred work of caring for one another. The Riverside Elementary School's Peace Garden had been designed by the children themselves, with winding paths that led to quiet alcoves where conflicts could be resolved through patient conversation rather than punishment or force. Principal Maria Santos walked slowly through the garden in the early morning light, observing how the space had evolved over the 5 years since the school had implemented its community peace program, transforming from a simple conflict resolution initiative into something much more profound, a comprehensive approach to education that taught children how to build and maintain peaceful communities. The garden's central pavilion contained comfortable seating arranged in circles that encouraged inclusive conversation while providing views of the surrounding flower beds and vegetable gardens that the children maintained as part of their integrated learning about cooperation, responsibility, and the patient care required to help living things flourish. The space had been designed to feel more like a peaceful outdoor living room than a formal institutional area, creating an atmosphere where children could develop the social and emotional skills that formed the foundation of community building. Maria paused at the memorial wall where children had placed stones painted with words and images representing their commitments to peaceful problem solving. The wall had been their own idea, created after learning about similar traditions in other cultures where communities marked important promises and shared values through collective art projects. Each stone represented a child's personal pledge to try understanding before judgment, patience before anger, and cooperation before competition in their daily interactions with classmates and teachers. The morning brought Maria's favorite part of the school day, the community circle time when children from different grade levels gathered to share concerns, celebrate successes, and practice the democratic decision-making skills that would serve them throughout their lives as active participants in peaceful communities. Today's circle included 24 children ranging in age from 6 to 12, each one bringing their own perspective and experience to the group's collective wisdom. Asterisk. 8-year-old David Martinez began by sharing his appreciation for Emma Thompson, a fifth grader who had helped him resolve a conflict with another student over playground equipment sharing. Rather than reporting the problem to teachers or escalating the conflict through retaliation, David had asked Emma to serve as a peer mediator, drawing on skills that all the children had learned through the school's comprehensive peace education curriculum. Emma described how she had listened carefully to both children's perspectives before helping them understand each other's needs and develop a solution that addressed everyone's concerns. The process had taken about 15 minutes and had resulted not just in resolving the immediate conflict, but in building a friendship between children who had previously avoided each other due to misunderstanding and miscommunication. 10-year-old Sarah Kim shared her experience with a family conflict at home, where she had used communication skills learned at school to help her parents work through a disagreement about household responsibilities. Sarah's intervention had surprised and impressed her parents, who had realized that their daughter possessed conflict resolution abilities that could benefit the entire family's communication and problem solving. The circle continued with children sharing various examples of how they had applied peace education principles in their daily lives, demonstrating that the skills they were learning extended far beyond the school environment to influence their families, neighborhoods, and other social situations. Maria had observed how children who learned effective conflict resolution often became informal teachers and mediators in their communities, sharing their skills with siblings, friends, and even adults who had not had similar educational opportunities. The Peace Garden also served as an outdoor classroom where children learned about the connections between environmental stewardship and community building, understanding that caring for the natural world required the same kinds of cooperation and long-term thinking that were necessary for maintaining peaceful human relationships. The vegetable gardens provided food for the school's lunch program while teaching children about nutrition, agriculture, and economic cooperation. Third-grade teacher Jennifer Rodriguez had developed an integrated curriculum that combined traditional academic subjects with peace education, showing children how math could be used to share resources fairly, how science could help them understand the interconnections between different living systems, and how language arts could help them express their thoughts and feelings clearly while understanding different perspectives. One current project involved the children working together to design and implement a composting system that would reduce the school's waste while providing rich soil for expanding the garden areas. The project required research, planning, cooperation, and ongoing maintenance that taught children about both environmental responsibility and the collaborative skills necessary for successful community projects. The children had also organized a conflict resolution training program for their parents and other family members, recognizing that the peace education they were receiving at school could be more effective if it was reinforced at home through family practices that emphasized communication, empathy, and collaborative problem solving. The parent training sessions were facilitated by the children themselves, who taught adults the same mediation and communication skills they were learning, while also sharing their perspectives on how families could create more peaceful and cooperative home environments. These sessions had proven popular with parents who appreciated learning from their children, while also developing their own skills for managing family conflicts. The afternoon brought Maria's work with the school's Peer Mediation Council, a group of older students who had received advanced training in conflict resolution and who served as resources for other children who were experiencing difficulties that they could not resolve independently. The council met weekly to discuss cases they had handled while also developing new approaches to common problems that arose in school communities. Today's meeting focused on a situation involving social exclusion, where a group of children had been excluding a new student from playground activities because of cultural and language differences that had created misunderstanding and discomfort. The peer mediators had worked with all the children involved to address both the immediate exclusion and the underlying fears and misconceptions that had contributed to the problem. The intervention had required several sessions over 2 weeks, during which the mediators had helped the children learn about different cultural traditions while also practicing communication strategies that could bridge language barriers and build understanding across differences. The new student had eventually become an accepted and valued member of the playground community while also serving as a cultural ambassador who taught other children about her family's traditions and experiences. The Peer Mediation Council had documented their approach to this case as a resource for other schools that might face similar challenges with cultural integration and social inclusion. Their documentation included specific strategies for addressing language barriers, cultural misunderstandings, and the kind of social dynamics that could lead to exclusion. If not addressed through proactive education and mediation, the council was also working on a project to create peer mediation programs in other schools throughout the district, training older students to serve as conflict resolution resources while adapting the Riverside Elementary model to different school cultures and populations. The project had attracted interest from educators in other states who were seeking effective approaches to reducing school conflicts while building positive school climates. The evening brought the school's monthly community learning circle, where children, parents, teachers, and neighborhood residents gathered to discuss how peace education could be extended beyond the school to influence broader community development. These circles had become important forums for democratic participation where people of all ages could contribute their perspectives while learning from each other's experiences. Tonight's circle focused on developing a neighborhood conflict resolution program that could address disputes between neighbors before they escalated to levels requiring official intervention. The program would be staffed by trained community volunteers, including some of the older students who had completed advanced peer mediation training, working under the supervision of adult mentors who had experience with community organizing and conflict resolution. The discussion revealed remarkable sophistication among the children, who understood that neighborhood conflicts often reflected underlying problems such as communication barriers, resource scarcity, or cultural misunderstandings that could be addressed through patient education and collaborative problem solving. Their perspectives often provided insights that adults had missed, particularly regarding the importance of including all community members in decision-making processes. 9-year-old Michael Chung suggested that the neighborhood program should include activities that brought people together for positive purposes, rather than just responding to conflicts after they occurred. His idea led to discussions about community gardens, cultural festivals, and skill-sharing workshops that could build relationships, while also addressing practical community needs. 11-year-old Lisa Rodriguez proposed that the program should include training for adults in the same communication and mediation skills that children were learning at school, recognizing that effective community building required all residents to have access to conflict resolution tools rather than depending on a few specialists to handle all disputes. The Community Learning Circle also addressed broader questions about how peace education could influence social policy and institutional practices beyond the immediate school and neighborhood context. Parents and community members shared experiences with workplace conflicts, legal disputes, and political disagreements that might be addressed more effectively through approaches based on communication, empathy, and collaborative problem solving. Several parents had begun organizing peace education workshops in their workplaces, adapting techniques their children had learned at school to address professional conflicts and improve organizational communication. These workplace applications had proven surprisingly effective, with several companies requesting additional training after observing improvements in employee satisfaction and productivity. Community members had also begun applying peace education principles to local government processes, advocating for town meetings and decision-making, procedures that emphasized inclusive participation and consensus building rather than adversarial debate and majority rule. These efforts had led to more collaborative approaches to municipal planning and budget decisions that had increased community satisfaction while reducing political conflicts. As the community learning circle concluded, Maria reflected on how the school's peace education program had evolved far beyond its original scope to influence family relationships, neighborhood dynamics, workplace cultures, and civic engagement throughout the broader community. The children who had learned conflict resolution skills were becoming teachers and leaders who shared their knowledge while continuing to develop new applications of peace education principles. The transformation had been gradual but profound, with the school becoming a center for community development that demonstrated how educational institutions could serve broader purposes than traditional academic instruction. The integration of peace education with standard curriculum had shown that children could achieve excellent academic outcomes while also developing the social and emotional skills that were necessary for building peaceful and just communities. Maria had been invited to share the Riverside Elementary model with educators around the world who were seeking effective approaches to peace education that could be adapted to different cultural contexts and educational systems. The school's documentation of their methods and outcomes had been translated into multiple languages and was being used to develop similar programs in countries facing various forms of social conflict and community division. However, Maria understood that the specific techniques and programs were less important than the underlying commitment to treating all community members with dignity and respect while providing opportunities for meaningful participation in collective decision-making. Successful peace education required recognizing that children possessed wisdom and capabilities that could contribute to community building when they were given appropriate support and encouragement. As she prepared to close the school for the evening, Maria walked once more through the Peace Garden, observing how the space continued to evolve as children added new elements and adapted existing features to serve their changing needs and interests. The garden had become a living symbol of how communities could grow and develop when they were tended with patience, creativity, and genuine care for the welfare of all participants. The children's voices from the day's activities seemed to linger in the garden's quiet spaces, carrying with them the promise of a future where conflicts would be transformed into opportunities for understanding, where differences would be celebrated as sources of strength rather than feared as threats, and where all people could contribute their unique gifts to the ongoing work of building communities where peace, justice, and love could flourish together. In the gentle twilight that settled over the Peace Garden, where children's wisdom was taking root in rich soil carefully prepared by patient teachers and community members, Maria felt the deep hope that came from witnessing the seeds of future peace being planted in young minds that would carry these lessons forward into a world that desperately needed their gifts of understanding, compassion, and collaborative problem-solving. The Harmony County Courthouse had been redesigned over the past decade to embody the principles of restorative justice that had gradually transformed how the community addressed crime and conflict. Judge Eleanor Martinez, now in her 20th Year on the bench, walk slowly through the building's central atrium in the early morning light, observing how the physical space itself had evolved to support approaches that emphasized healing and community building rather than punishment. And separation. The traditional courtroom with its elevated judge's bench and formal barriers between different participants had been replaced by a circular meeting space with comfortable seating arranged to encourage conversation and mutual understanding. Large windows provided natural light while offering views of the community garden that had been created in the courthouse's outdoor spaces, where participants in restorative justice processes often worked together on projects that contributed to community welfare while providing opportunities for relationship building and skill development. Judge Martinez had been instrumental in developing Harmony County's comprehensive approach to restorative justice, working with community leaders, social service agencies, and residents to create alternatives to traditional criminal justice procedures that addressed underlying causes of criminal behavior while providing more meaningful support for victims and more effective rehabilitation for offenders. The transformation had begun 15 years earlier with a single case involving teenage vandalism at the local high school. Rather than processing the case through traditional juvenile court procedures, Judge Martinez had organized a community conference that brought together the teenagers, their families, school officials, and community members to develop a response that addressed both the immediate damage and the underlying issues that had motivated the destructive behavior. The conference had revealed that the vandalism had been an expression of frustration with what the teenagers perceived as a lack of opportunities for meaningful participation in community life. Working together, the participants had developed a youth engagement program that provided leadership opportunities and community service projects, while also establishing a teen court where young people could address conflicts among themselves with appropriate adult support and guidance. The success of that initial case had led to gradual expansion of restorative approaches throughout the county's justice system, with community conferences becoming standard practice for most first-time offenses and many repeat cases where participants were willing to engage in the collaborative problem-solving process that restorative justice required. The courthouse's mediation center had become the heart of this transformation, providing space for the kinds of extended conversations that were necessary for genuine understanding and healing to occur. The center's rooms were designed to feel more like comfortable living spaces than institutional facilities, with soft lighting, flexible seating arrangements, and artwork created by community members who had participated in restorative justice processes. This morning, Judge Martinez was preparing for a community conference involving a domestic violence case where both the victim and the perpetrator had requested restorative justice intervention rather than traditional prosecution. The case required careful attention to safety concerns while also providing opportunities for the kind of accountability and behavior change that could prevent future incidents. The preparation had involved weeks of individual meetings with both parties, their families, and community supporters to ensure that everyone understood the process and felt safe participating in the collaborative discussion that would focus on addressing harm while building support systems that could prevent future violence. The victim, Maria Rodriguez, had specifically requested restorative justice because she wanted her partner to receive treatment and education rather than simply punishment that might not address the underlying issues that had contributed to his violent behavior. She had also wanted opportunities to express how the violence had affected her while receiving community support that could help her rebuild her sense of safety and autonomy. The perpetrator, James Wilson, had accepted responsibility for his actions and had already begun attending counseling and anger management programs while participating in community service projects that allowed him to develop positive relationships and constructive ways of managing stress and conflict. Asterisk. The community conference would bring together both parties along with their family members, friends, counselors, and community volunteers who would work together to develop a comprehensive plan for accountability, treatment, and ongoing support that addressed everyone's needs while prioritizing victim safety and community welfare. Judge Martinez had learned that successful restorative justice interventions in domestic violence cases required extensive preparation and ongoing monitoring to ensure that the process truly served victim needs, rather than simply providing alternatives to appropriate legal consequences. The county had developed specialized protocols and training for these complex cases, while maintaining traditional legal options when restorative approaches were not appropriate or safe. The morning conference began with a talking circle where each participant could share their perspectives and feelings about the situation without interruption or immediate response from others. This process allowed everyone to be heard while also creating opportunities for understanding different viewpoints and experiences that had contributed to the conflict. Maria Rodriguez spoke about how the violence had affected not just her physical safety, but her ability to trust and feel secure in her own home and community. She described her desire for James to understand the impact of his actions, while also receiving the kind of support and treatment that could help him change his behavior permanently rather than simply avoiding legal consequences. James Wilson acknowledged the harm he had caused while describing his own struggles with stress, depression, and family history that had contributed to his violent behavior. He expressed genuine remorse for his actions while outlining the steps he had already taken to address underlying issues and his commitment to continuing treatment and community service, regardless of legal outcomes. Family, members, and friends from both sides shared their perspectives on how the violence had affected their relationships and community connections, while expressing their willingness to provide ongoing support for both accountability and healing processes that would benefit everyone involved. Community volunteers described programs and resources that were available to support both victim safety and offender rehabilitation, including counseling services, support groups, job training, and community service opportunities that could provide structure and positive social connections during the recovery process. The conference continued with collaborative development of a comprehensive agreement that addressed immediate safety concerns while also establishing long-term goals and support systems for both parties. The agreement included regular check-ins with counselors and community volunteers, ongoing participation in treatment programs, and community service projects that would allow James to make positive contributions while developing skills and relationships that could support continued behavior change. Maria Rodriguez would receive ongoing support from domestic violence advocates while participating in community activities that could help her rebuild confidence and social connections that had been damaged by the violence. The agreement also included provisions for monitoring and enforcement that would ensure accountability while providing flexibility to adapt the plan as circumstances changed. Judge Martinez had observed how these community conferences often produced more comprehensive and effective outcomes than traditional court proceedings, with agreements that addressed underlying causes rather than just immediate legal issues, while building community capacity to provide ongoing support and monitoring that could prevent future problems. The afternoon brought Judge Martinez's work with the county's drug court program, which had integrated restorative justice principles with treatment and recovery support to create alternatives to incarceration for people struggling with substance abuse issues. The program emphasized community engagement and peer support, while providing comprehensive services that addressed the complex factors that often contributed to addiction and related criminal behavior. Today's session included 12 participants who were at various stages of recovery and legal resolution, working with counselors, family members, and community volunteers to address their substance abuse while making amends for crimes they had committed and developing the skills and relationships necessary for sustained recovery and positive community participation. The drug court had become one of the county's most successful programs, with graduation rates exceeding 90% and recidivism rates significantly lower than traditional prosecution approaches. More importantly, graduates often became peer counselors and community volunteers who helped other people navigate recovery, while contributing their experience and insights to program improvement. The program's success had been attributed to its emphasis on community support and accountability rather than simply individual treatment, recognizing that sustained recovery required changes in social relationships and community connections, as well as personal behavior modification. Participants worked together on community service projects while attending group counseling sessions that built mutual support, networks extending beyond the formal program period. The evening brought the monthly Community Justice Circle, where residents could discuss local issues and conflicts, while practicing the collaborative problem-solving skills that had become central to Harmony, County's approach to community development. These circles had evolved from the justice system's restorative practices to become important forums for democratic participation and community organizing. Tonight's circle addressed concerns about youth engagement and recreation opportunities that had been raised by parents and teenagers who wanted to prevent the kind of boredom and social isolation that could contribute to behavioral problems and minor criminal activity. The discussion involved people of all ages working together to identify resources and develop programs that could provide positive outlets for young people's energy and creativity. The participants included several graduates of the county's various restorative justice programs who had become community leaders and advocates for continued expansion of collaborative approaches to social problems. Their involvement demonstrated how restorative justice could create positive cycles, where people who had received community support became providers of assistance and leadership for others facing similar challenges. The circle's discussions led to plans for expanding the youth engagement programs that had grown out of the original teen court initiative, with additional funding and volunteer support for activities ranging from environmental restoration projects to arts and cultural programs that could engage young people while building their skills and community connections. Judge Martinez had been invited to share Harmony, County's restorative justice model, with communities throughout the region and beyond, providing consultation and training for jurisdictions that wanted to implement similar approaches while adapting them to different cultural contexts and local circumstances. The county's documentation of their methods and outcomes had influenced policy development at state and national levels while contributing to broader understanding of effective alternatives to traditional criminal justice approaches. However, she understood that the specific programs and procedures were less important than the underlying commitment to treating all community members with dignity and respect, while addressing problems through collaborative engagement rather than adversarial processes. Successful restorative justice required recognizing that crime and conflict were symptoms of broader social conditions that could be addressed more effectively through community building than through punishment and separation. The county's transformation had been gradual but comprehensive, with restorative justice principles influencing not just criminal cases, but family court proceedings, school discipline policies, workplace conflict resolution, and neighborhood dispute mediation. The courthouse had become a community resource center that provided training and support for democratic participation and collaborative problem solving throughout the county. As Judge Martinez concluded her day, she reflected on how much the community had changed since the implementation of restorative justice approaches and how much more change would be possible as residents continued developing their capacity for addressing conflicts through understanding and cooperation rather than force and punishment. The courthouse clock tower that had once marked time in the traditional rhythms of legal proceedings now overlooked a community that had learned to measure progress in terms of relationships healed, skills developed, and social conditions improved, through patient attention to underlying causes rather than immediate symptoms. In the peaceful evening light that settled over Harmony County, where justice moved at the pace of understanding and every resolution carried the weight of transformed hearts, Judge Martinez felt the deep satisfaction that came from witnessing a community's capacity for healing and growth through approaches that honored the dignity and potential of all participants while building stronger foundations for sustained peace and mutual care. The work would continue tomorrow, with new cases providing new opportunities to demonstrate that justice achieved through understanding was not just more humane but more effective than punishment-based approaches in creating communities where crime became unnecessary because people's needs were met through relationship and mutual support rather than individual struggle and competition. Asterisk, the Intergenerational Wisdom Center had been built on the grounds of what was once the county's largest detention facility. Its open architecture and welcoming gardens creating a space where the accumulated knowledge of community elders could be shared with younger generations who were carrying forward the work of building peaceful and just communities. Elder Council Coordinator Margaret Foster, now 83 years old with 6 decades of community service behind her, moved slowly through the center's main hall in the early morning light, observing how the space had become a living bridge between past experience and future possibility. The center's design reflected its purpose, with comfortable gathering areas that encouraged intergenerational conversation, while providing quiet spaces for reflection and individual consultation. The walls contained photographs and artifacts, documenting the community's transformation over the past 50 years. Creating a visual narrative of how patient organizing and collaborative problem-solving had gradually replaced conflict and punishment as the primary responses to social challenges. Margaret paused at the memorial wall where community members had placed photographs and brief tributes to elders who had passed away after contributing their wisdom to the transformation process. Each tribute told a story of someone who had devoted their later years to sharing knowledge gained through decades of experience with conflict resolution, community building, and the gradual development of more effective and humane approaches to social problems. Her own journey to this role had begun 40 years earlier when she had been a young mother struggling with family conflicts that had brought her into contact with the early pioneers of restorative justice and community mediation. The support and guidance she had received during her own difficult period had inspired her to become a volunteer mediator and eventually a leader in developing programs that could help other families address their challenges through collaboration rather than legal intervention. The morning brought Margaret's favorite part of her work, facilitating conversations between elders who had lived through the communities transformation and younger residents who were developing new approaches to contemporary challenges while building on the foundation of accumulated wisdom that previous generations had created. Today's gathering included 12 elders and 15 community members ranging in age from 25 to 45, all of whom were working on various aspects of community development and conflict prevention. The conversations began with storytelling, as elders shared experiences from earlier decades when the community had been learning to implement alternatives to traditional criminal justice and social service approaches. 80-7-year-old Robert Chun, who had served as a police officer during the early years of community policing development, described how difficult it had been to convince both law enforcement professionals and community members that collaborative approaches could be more effective than traditional enforcement methods. His stories revealed the patience and persistence that had been required to overcome skepticism and fear while building trust between police and residents who had historically viewed each other with suspicion. Robert's accounts of individual cases from the 1980s provided insights into how community policing techniques had been developed through trial and error, with officers learning to listen carefully to residents while adapting their approaches based on what worked in different neighborhood contexts. His experiences had taught him that effective law enforcement required understanding cultural differences and Community dynamics rather than simply applying universal procedures. 70-9-year-old. Maria Rodriguez, who had been one of the first community aiders trained in the county's early restorative justice programs, shared stories about how difficult family and neighborhood conflicts had been resolved through patient conversation and collaborative problem solving. Her experiences had demonstrated that many situations that seemed to require legal intervention could actually be addressed more effectively through mediation that allowed all parties to express their concerns while working together toward mutually acceptable solutions. Maria's stories revealed how much courage had been required for people to try new approaches to problems that had traditionally been handled through formal legal procedures. Early participants in restorative justice programs had been pioneers who were willing to risk criticism and potential failure in order to find better ways of addressing conflicts while building stronger community relationships. The conversation moved to contemporary challenges as younger community members described situations they were facing that required adapting established principles to new circumstances. Climate change, technological disruption, and changing economic conditions were creating social stresses that had not existed when many of the community's programs had been originally developed. 30-2-year-old. David Kim, who worked with the county's environmental justice program, described how climate change adaptation efforts were requiring new forms of community organizing that brought together people with different perspectives on environmental protection and economic development and social equity. The challenges were complex because solutions that addressed environmental concerns sometimes created economic difficulties for families that were already struggling financially. The elders' responses revealed how similar challenges had been addressed in earlier decades when economic transitions had created conflicts between different community groups with competing interests. They shared strategies for building coalitions that could address multiple concerns simultaneously while maintaining focus on shared values and long-term community welfare rather than short-term individual advantages. 20-8-year-old Jennifer Martinez, who coordinated the county's digital literacy and online safety programs, discussed how social media and digital technologies were creating new forms of conflict and community division that required innovative approaches to mediation and relationship building. Online harassment, misinformation, and social isolation were affecting particularly vulnerable community members in ways that traditional support systems had difficulty addressing. The elders acknowledged that these technological challenges were beyond their direct experience, but they offered insights about building trust and communication across different groups that could be adapted to digital environments. Their emphasis on face-to-face relationship building as the foundation for all other forms of communication provided guidance for using technology to enhance rather than replace personal connections. The afternoon session focused on what the group called legacy planning discussions about how the wisdom and experience of current elders could be preserved and transmitted to future generations who would face their own unique challenges while building on the foundation that had been created through decades of patient community building work. The elders had been working on various documentation projects that captured not just the history of specific programs and policies, but the deeper insights about human nature, social relationships, and community dynamics that they had gained through years of experience with conflict resolution and collaborative problem solving. 74-year-old Linda Thompson, who had coordinated youth programs for 30 years before retiring, had been collecting stories about successful interventions with young people who had been considered unreachable through traditional approaches. Her collection revealed patterns in what worked with different types of youth challenges while preserving insights about building relationships with young people who had experienced trauma, family instability, or social rejection. Linda's documentation project had evolved into a training program for new youth workers that combined practical skills with deeper understanding of how to create environments where young people could develop trust and hope while learning to make positive contributions to their communities. The program had been adopted by organizations throughout the region as an effective approach to youth development that addressed underlying causes rather than just behavioral symptoms. 81-year-old Michael Torres, who had worked in economic development and community organizing, had been documenting strategies for building coalitions between different groups that had historically been in conflict over resource allocation and development priorities. His insights revealed how communities could address economic challenges through cooperative approaches that benefited everyone rather than competitive struggles that created winners and losers. Michael's work had influenced the development of community-controlled economic development programs that emphasized local ownership and democratic decision-making while providing opportunities for people from different backgrounds to work together on projects that strengthened the entire community's economic foundation. Legacy planning discussions also addressed how younger community members could continue adapting established principles to new circumstances while maintaining the core values and approaches that had proven effective over time. The elders emphasized that specific programs and procedures were less important than underlying commitments to treating all community members with dignity and respect while addressing problems through collaborative engagement rather than top-down solutions. The evening brought the center's monthly community wisdom sharing event, where people of all ages gathered to celebrate successes, discuss challenges, and practice the democratic participation skills that formed the foundation of the key community's approach to governance and problem solving. Tonight's gathering included over 60 community members who shared stories about recent applications of restorative justice, community mediation, and collaborative organizing principles in their families, workplaces, and neighborhood contexts. The stories revealed how broadly these approaches had spread throughout the community while adapting to address diverse situations and challenges that several high school students shared. Experiences with peer mediation programs that were helping them address conflicts while developing leadership skills that would serve them throughout their lives. Their accounts revealed remarkable sophistication in understanding conflict dynamics and communication strategies that many adults had taken years to develop. Parents described how they were using family meeting and collaborative decision-making approaches learned through community programs to address household conflicts while teaching their children democratic participation skills. These family applications were creating more peaceful home environments while preparing young people to become effective community members and leaders. Business owners shared experiences with workplace mediation and collaborative management approaches that had improved employee satisfaction and productivity while reducing conflicts that had previously required formal disciplinary procedures or legal intervention. These workplace applications were demonstrating how community building principles could enhance economic effectiveness while creating more humane and democratic work environments. As the community wisdom sharing concluded, Margaret reflected on how the evening stories revealed the remarkable extent to which collaborative and restorative approaches had become integrated into daily life throughout the community. The transformation had been so gradual and comprehensive that many residents probably took for granted approaches to conflict and problem-solving that would have seemed impossible to earlier generations. The success had been achieved through the patient work of thousands of individuals who had chosen cooperation over competition, understanding over judgment, and long-term community building over short-term individual advantage. Each generation had built upon the foundation created by their predecessors while adapting and improving approaches to address their own unique circumstances and challenges. Margaret had been documenting the intergenerational wisdom transfer process itself, understanding that the methods used to share knowledge and experience between generations were as important as the specific content being transmitted. Her research had revealed how different types of wisdom required different transmission approaches, with some insights best shared through storytelling, others through mentoring relationships, and still others through collaborative work on practical projects. The documentation would be used to help other communities develop their own intergenerational wisdom sharing programs while also preserving insights that could benefit future generations who would face challenges that current residents could not yet imagine. As Margaret prepared to close the center for the evening, she walked once more through the halls where photographs and artifacts preserved the visual history of the community's transformation. The images showed how the physical landscape had changed as detention facilities had been converted to community centers. Vacant lots had become gardens and gathering places, and institutional buildings had been redesigned to support collaboration rather than control. However, the most important changes had been invisible: the development of social relationships, communication skills, and collaborative problem-solving capabilities that had transformed how people related to each other and addressed shared challenges. These changes could not be captured in photographs but were evident in the quality of daily interactions and the community's capacity to address new problems with confidence and creativity. In the peaceful evening light that settled over the Intergenerational Wisdom Center, where the accumulated understanding of generations was being carefully tended and shared like seeds planted in rich soil, Margaret felt the deep satisfaction that came from knowing that her own life's work would continue through the countless people who had learned to choose understanding over fear, cooperation over competition, and hope over despair in the endless human project of building communities where all could flourish together in safety, justice, and peace. The wisdom would continue to grow and adapt, enriched by each new generation's contributions while maintaining the essential understanding that human beings could indeed learn to live together peacefully when they committed themselves to the patient work of building relationships based on mutual respect, shared responsibility, and genuine care for each other's welfare. The Community Lighthouse Center stood on the bluff overlooking Harmony Bay, its renovated beacon tower serving not as a navigation aid for ships, but as a symbol of hope for communities around the world that were seeking guidance in their own journeys toward justice, peace, and mutual understanding. Director Elena Santos, now in her 10th year of coordinating the center's global outreach programs, climbed the lighthouse's winding stairs in the pre-dawn darkness, carrying with her the accumulated wisdom of countless communities that had learned to transform conflict into collaboration through patient dedication to human dignity and democratic participation. The lighthouse's observation deck provided panoramic views of the surrounding landscape where decades of community building had created a living demonstration of how human settlements could be organized around principles of cooperation rather than competition, understanding rather than fear, and restoration rather than punishment. From this vantage point, Elena could see the neighborhoods, schools, businesses, and public spaces where millions of individual acts of kindness and understanding had accumulated over time to create conditions where crime had become not just rare but largely unnecessary because people's needs were met through relationship and mutual support. Center had been established 5 years earlier as a response to requests from communities throughout the world that wanted to learn from the transformation that had occurred in Harmony County and similar locations where comprehensive approaches to community building had produced remarkable improvements in safety, well-being, and social cohesion. The lighthouse metaphor had been chosen to represent the center's role as a beacon that could help guide other communities through their own difficult passages toward more peaceful and just ways of living together. Elena began her morning meditation with review of reports from the center's partner communities. Dozens of locations on every continent where local leaders were adapting principles of restorative justice, community policing, and collaborative problem-solving to their own unique cultural contexts and social conditions. These reports painted a picture of global transformation that was both inspiring and humbling, showing how ideas that had emerged from small-scale experiments in community healing were influencing the development of more humane and effective approaches to social organization throughout the world. The Kibra Peace Project in Nairobi had combined traditional African conflict resolution practices with contemporary restorative justice approaches to create community mediation systems that had dramatically reduced violence while building economic opportunities for residents who had previously been marginalized by poverty and social exclusion. The project's success had been documented through careful research that showed how cultural wisdom could be enhanced rather than replaced by modern community development techniques. Similar adaptations had emerged throughout Latin America, where indigenous community organizing traditions were being integrated with contemporary approaches to environmental justice and economic development. The Pachamama Community Network in Peru had created regional coalitions that addressed both environmental restoration and social healing through projects that recognized the connections between ecological health and community. While European cities had developed their own variations, with the Barcelona Neighborhood Circles program, creating networks of resident-led mediation services that had become models for urban community building throughout the Mediterranean region. The program had been particularly successful in addressing conflicts related to immigration and cultural integration, demonstrating how diversity could become a source of community strength rather than division when differences were approached with curiosity and respect rather than fear and suspicion. Elena found herself particularly moved by reports from post-conflict regions where communities were using restorative justice principles to address the complex challenges of recovery from war, genocide, and other forms of collective trauma. The Rwandan Community Reconciliation Initiative had shown how traditional Gakaka court procedures could be adapted to create comprehensive healing processes that addressed both individual harm and community restoration, while building foundations for sustained peace. The center's main exhibition hall contained displays showing how community building principles were being applied to address contemporary global challenges including climate change, technological disruption, and economic inequality. These displays revealed the remarkable creativity and adaptability of communities that had learned to approach problems through collaborative engagement rather than competitive struggle. One section focused on climate adaptation projects that were combining environmental restoration with community organizing to create resilient strategies that addressed both ecological and social challenges simultaneously. The Green Communities Network had documented dozens of examples where neighborhood organizing around environmental issues had also strengthened social relationships and democratic participation while building local capacity for addressing various types of challenges. Asterisk. Another display showed how digital technologies were being used to enhance rather than replace face-to-face community building, with online platforms facilitating communication and coordination while maintaining emphasis on personal relationships and local engagement. The Digital Democracy Project had developed tools that helped communities organize more effectively while preserving the kinds of intimate social connections that formed the foundation of sustainable community development. The morning brought Elena's work with the Center's International Fellowship Program, which brought community leaders from around the world to Harmony County for intensive learning experiences that combined study of local approaches with development of adaptation strategies for their own contexts. Today's session included 12 fellows from 6 different countries who were working on various aspects of community development and conflict prevention. The session began with presentations from each fellow about their current projects and challenges, revealing both the diversity of approaches being used around the world and the underlying principles that seem to be universal across different cultural contexts. Whether in rural villages or urban neighborhoods, successful community building required patient attention to relationship development, inclusive decision-making processes, and comprehensive approaches that addressed underlying causes rather than just immediate symptoms. A fellow from rural Bangladesh described how traditional village council approaches had been adapted to include women, young people, and community decision-making while addressing contemporary challenges related to climate change and economic development. The adapted councils had proven effective at managing flooding and crop failures while also addressing family conflicts and other social issues that could disrupt community cohesion during difficult periods. A participant from Snow Paulo shared experiences with favela organizing that had transformed areas of high violence into neighborhoods where residents felt safe to develop cultural programs and economic enterprises. The transformation had required years of sustained engagement between residents and sympathetic police officers who had learned to work as community partners rather than outside enforcers. Fellow from Belfast discussed how post-conflict community organizing had created new forms of democratic participation that bridged historical divisions while addressing contemporary challenges related to economic inequality and social exclusion. The organizing had been particularly successful because it focused on shared concerns about education and economic opportunity rather than relitigating historical grievances. As the fellowship session continued, Elena observed how each community had developed its own unique variation of basic principles while maintaining core commitments to inclusive participation, restorative rather than punitive responses to problems, and comprehensive approaches that addressed underlying causes of social difficulties. The diversity of specific applications demonstrated that community building was both an art and a science, requiring creativity and cultural sensitivity, while also following established principles of effective social organization. The session concluded with collaborative planning for projects that could draw on resources and expertise from multiple communities while respecting the autonomy and cultural integrity of each local context. Climate change adaptation, youth engagement, and economic development emerged as areas where communities could benefit from sharing knowledge and coordinating responses to challenges that transcended local boundaries. The afternoon brought Elena's favorite aspect of her work, facilitating conversations between visitors and local community members who could share their experiences with the transformation process while learning about different approaches to similar challenges. These conversations provided opportunities for mutual learning that enriched understanding on all sides, while building relationships that could support ongoing collaboration and mutual assistance. Today's conversation included the international fellows along with about 20 local residents who represented different aspects of the community's development over the past several decades. The discussion began with storytelling, as local residents shared experiences from different periods in the transformation process, while visitors described their own community's attempts to address similar challenges. Retired police captain Robert Hayes described how community policing had evolved from experimental programs in the 1980s to become the standard approach throughout the county, with officers serving as community resources and problem solvers rather than primarily law enforcers. His accounts revealed the patience and persistence that had been required to change both police and community attitudes, while building trust that had been damaged by years of adversarial relationships. Former Judge Eleanor Martinez shared stories about the development of restorative justice programs that had transformed the courthouse from a place of punishment into a center for community healing and collaborative problem solving. Her experiences had demonstrated that alternatives to traditional criminal justice procedures could be more effective in preventing crime while also more satisfying for victims and more conducive to positive behavior change among offenders. Community organizer Maria Rodriguez described how neighborhood organizing had created networks of mutual support that could address most local problems before they required formal intervention, while also building social connections that made communities more resilient in the face of various challenges. Her work had shown how ordinary residents could become effective leaders when they were provided with appropriate training and support. The conversations revealed how the community's transformation had been achieved through the accumulated efforts of thousands of individuals who had chosen cooperation over competition, understanding over judgment, and patient relationship building over quick fixes that might address symptoms while ignoring underlying causes. Visitors were particularly interested in understanding how different cultural values and social conditions might require adaptations of successful approaches while maintaining core principles that seemed to be universal across different contexts. The discussions revealed remarkable sophistication in understanding how local wisdom could be combined with external models to create approaches that honored cultural traditions while addressing contemporary challenges. The evening brought the center's monthly Global Community Forum, where representatives from partner communities around the world gathered virtually to share experiences, discuss challenges, and coordinate collaborative responses to global issues that affected all communities while requiring locally appropriate solutions. Tonight's forum focused on youth engagement and education, exploring how different communities were preparing young people to become effective leaders and problem solvers while preserving cultural traditions and values that provided foundations for community identity and social cohesion. Representatives from 12 countries shared innovative approaches to peace education, environmental stewardship, and democratic participation that were helping young people develop skills and perspectives that would serve them throughout their lives as community builders and global citizens. The diversity of approaches was remarkable, but underlying themes included emphasis on experiential learning, intergenerational mentorship, and opportunities for meaningful participation in addressing real community challenges. The forum discussions led to planning for collaborative projects that could connect young people from different communities while providing opportunities for mutual learning and cultural exchange. These projects would combine virtual communication with opportunities for travel and direct experience that could build lasting relationships and shared commitment to global peace and justice. As the Global Community Forum concluded, Elena reflected on how the Lighthouse Center had become something she had not originally envisioned. not just a resource for communities seeking to learn from one successful example, but a hub for global networking that was facilitating innovation and mutual support among communities that were developing their own unique approaches to building more peaceful and just societies. Transformation was occurring on multiple levels simultaneously, with local communities developing greater capacity for addressing their own challenges while also contributing to global movements for social change that were influencing policy development and institutional reform throughout the world. Elena climbed once more to the lighthouse's observation deck, where the evening light was beginning to fade into the peaceful darkness that would soon envelope the community. From this vantage point, she could see lights beginning to appear in homes and gathering places throughout the surrounding area, each one representing families and communities that were living their daily lives with confidence that their neighborhoods provided both safety and opportunity for positive engagement. The lighthouse beam had begun its nightly rotation, sending its message of hope and guidance across waters that connected this small community to countless others around the world that were working towards similar goals of peace, justice, and mutual understanding. The light would continue its patient work throughout the night, just as communities everywhere continued their patient work of building relationships and solving problems through collaboration rather than conflict. In the peaceful darkness that settled over Harmony Bay, where the lighthouse stood as a beacon for communities seeking guidance in their own journeys toward justice and peace, Elena felt the deep satisfaction that came from participating in humanity's gradual evolution toward forms of social organization that honored the dignity and potential of every person while creating conditions where all could flourish together in safety, justice, and love. The work would continue tomorrow and the day after that, as communities throughout the world contributed their own experiences and innovations to the growing understanding of how human beings could create societies based on cooperation rather than competition, understanding rather than fear, and hope rather than despair in the endless human project of building heaven on earth through patient attention to the sacred work of caring for one another. The lighthouse beam swept across waters that carried not ships of war, but vessels of understanding, guiding them towards safe harbor in communities that had learned to welcome every soul seeking peace, transformation, and the opportunity to contribute their unique gifts to the collective work of building a world where justice and compassion could reign together in perfect harmony. Asterisk. The Memorial Grove had been planted 40 years earlier on land that had once housed the county's maximum security prison. Its ancient oak trees, now towering over walking paths and meditation circles where families and communities gathered to remember those who had been lost to violence while celebrating the transformative journey that had led to healing and hope. Grovekeeper Samuel Martinez moved through the early morning mist with the reverent care of someone who understood that he was tending not just trees and gardens, but the living memory of a community's evolution from punishment toward restoration, from separation toward connection. Each tree in the grove had been planted to honor a specific victim of violence, while the pathways between them told the stories of how their deaths had catalyzed community responses that addressed underlying causes of harm while building networks of support that prevented future tragedies. The grove served as both memorial and promise, preserving the memory of loss while demonstrating the community's commitment to ensuring that such losses would not be in vain. Samuel paused beside the memory circle at the grove's heart, where families gathered each month to share stories about loved ones they had lost, while participating in ongoing healing processes that had transformed grief into advocacy for justice and peace. The circle's stone benches were arranged to encourage intimate conversation while providing views of the surrounding trees whose seasonal changes mirrored the natural cycles of mourning and renewal that characterized healthy grieving processes. This mourning brought the monthly family healing gathering, where relatives of crime victims met with family members of those who had caused harm, working together and facilitated conversations that addressed the complex emotions and practical challenges that arose when communities chose restoration over retribution as their primary response to serious criminal behavior. These gatherings represented some of the most challenging and rewarding aspects of the community's restorative justice work, requiring enormous courage from all participants while producing healing outcomes that traditional criminal justice procedures could never achieve. The gathering began in the Grove's main pavilion, where comfortable seating and natural lighting created an atmosphere conducive to the kind of deep emotional work that the participants would be undertaking together. Samuel had helped design the space specifically for these challenging conversations, understanding that physical environments could either support or hinder the delicate process of building understanding between people whose lives had been connected by tragedy and loss. Today's gathering included 8 families affected by serious crimes that had occurred over the past 3 years, all of whom had chosen to participate in restorative justice processes rather than relying solely on traditional criminal prosecution. The crimes had included domestic violence resulting in death, drunk driving fatalities, armed robbery, and assault, representing the kinds of serious offenses that had historically been considered inappropriate for restorative approaches, but that the community had learned to address through carefully structured processes that prioritize victim needs while creating opportunities for genuine accountability and healing. Session opened with a moment of silence for all those who had been lost to violence, followed by individual sharing from family members who wanted to speak about their loved ones and the impact that their deaths had created in the lives of those who survived them. These testimonies served not as accusations against those who had caused harm, but as witness to the full humanity and value of lives that had been cut short, creating foundation for the healing work that would follow. Maria Gonzalez spoke about her 18-year-old son Carlos, who had been killed by a drunk driver 3 years earlier while walking home from his job at the community center where he had been volunteering with younger children. Maria's testimony described not just her devastating loss, but also Carlos's dreams of becoming a teacher and his commitment to helping other young people develop the skills and confidence they needed to make positive contributions to their communities, rather than focusing solely on her anger and grief. Maria had chosen to participate in a restorative justice process that brought her into conversation with the young man who had been driving drunk when he killed her son. The process had been emotionally difficult and had required months of preparation and support, but it had allowed her to express the full impact of her loss while also learning about the circumstances that had led to the tragedy. The drunk driver, 22-year-old David Chun, had been struggling with alcoholism and depression following his father's death, using alcohol to numb emotional pain that he had not known how to address through healthier means. His participation in the restorative process had required him to confront not just the harm he had caused, but the underlying problems that had contributed to his dangerous behavior. The restorative agreement that had emerged from their conversations included David's commitment to long-term treatment for alcoholism and depression, extensive community service with organizations that address substance abuse prevention, and ongoing payments to support the community center program where Carlos had volunteered. More importantly, David had become an advocate for drunk driving prevention, sharing his story at high schools and community events while working to prevent other families from experiencing similar tragedies. Maria described how the restorative process had not eliminated her grief, but had transformed it into a force for positive change that honored her sons, memory while preventing future harm. She had become a volunteer victim advocate who helped other families navigate restorative justice options while continuing to work with David on prevention programs that addressed underlying causes of drunk driving rather than simply punishing its consequences. The healing gathering continued with similar testimonies from other participants, each one revealing how restorative justice processes had addressed serious crimes through approaches that created accountability while building understanding and preventing future harm. The stories demonstrated that even the most devastating losses could become sources of healing and positive change when communities committed themselves to addressing underlying causes. Rather than simply responding to symptoms, Robert Thompson shared his experience as the father of someone who had committed a serious assault, describing how his family had struggled with shame and isolation following his son's arrest while working to understand what had led to the violent behavior and how they could support both accountability and positive change. His participation in restorative justice had connected him with the victim's family, while also providing resources for addressing his son's mental health issues and substance abuse problems. The assault had occurred during a mental health crisis that had been exacerbated by untreated trauma and alcohol abuse, problems that had been developing for years without his family recognizing the warning signs or understanding how to access appropriate help. The restorative process had provided education about mental health resources while creating support systems that could assist with ongoing recovery and prevent future incidents. Robert's son had completed intensive treatment for trauma and substance abuse while also participating in community service projects that had helped him develop positive relationships and life skills. The young man had become a peer counselor who worked with other people struggling with similar issues, using his experience to help prevent violence while making ongoing amends for the harm he had caused. The gathering moved from individual testimony to facilitated conversations between participants who wanted to explore common themes and mutual support opportunities that could strengthen their ongoing healing processes. These conversations revealed remarkable capacity for empathy and understanding among people who might have been expected to remain divided by their different relationships to criminal events. Victim family members offered support and understanding to families of those who had caused harm, recognizing that everyone had been affected by the violence and that healing required addressing the pain and isolation experienced by all participants. Family members of those who had committed crimes provided practical assistance and emotional support to victim families while working to understand and address the factors that had contributed to harmful behavior. The afternoon session focused on community education and advocacy, with families working together to develop prevention programs that could address the underlying social conditions that contributed to criminal behavior while building community capacity to support both victims and offenders in their healing journeys. One collaborative project involved developing substance abuse prevention programs that address trauma, mental health, and social isolation as interconnected factors that could lead to dangerous behavior when left untreated. The program combined education about warning signs with practical resources for accessing treatment, while creating community support networks that could provide ongoing assistance during recovery processes. Another project focused on domestic violence prevention, combining education about healthy relationships with community organizing that addressed economic stress, social isolation, and cultural factors that could contribute to intimate partner violence. The program emphasized early intervention and community support rather than waiting to respond to violence after it occurred. the evening brought the Grove's monthly memorial service, where the broader community gathered to remember all those who had been lost to violence, while celebrating the progress that had been made in building safer and more just communities. The service combined mourning with hope, acknowledging loss while affirming commitment to continued progress toward preventing future tragedies. The service began with families lighting candles for their loved ones while sharing brief memories that celebrated lives, rather than focusing primarily on the manner of death. Each candle represented not just individual loss, but community commitment to ensuring that deaths would not be meaningless but would inspire continued work toward justice and prevention. Samuel read the names of all those who had been remembered in the Grove over the past 4 decades, creating a litany that honored the dead while demonstrating the community's sustained commitment to learning from tragedy and building responses that addressed underlying causes rather than simply punishing consequences. The service concluded with collective commitment to continued work toward community healing and violence prevention, with participants making specific pledges about actions they would take in the coming month to support families affected by violence while working to create conditions where such tragedies would become increasingly rare. Community members committed to volunteering with victim services, supporting substance abuse treatment programs, advocating for mental health resources, and participating in restorative justice processes that could address harm while building understanding and preventing future violence. As the memorial service ended and darkness settled over the Grove, Samuel walked once more among the trees, whose growth had paralleled the community's own development from punishment toward restoration, from separation toward connection. The oak trees had absorbed decades of conversation and ceremony, their roots deep in soil enriched by tears and laughter, conflict and reconciliation, loss and renewal. The Grove would continue its patient witnessing through the night and into tomorrow, holding space for grief while nurturing hope, preserving memory while encouraging growth, demonstrating that even from the deepest wounds, new life could emerge when communities committed themselves to the patient work of healing that honored both loss and possibility. In the gentle darkness of Memorial Grove, where ancient oaks held the stories of transformation in their living wood and whispering leaves, Samuel felt the deep peace that came from tending sacred space where memory and healing intertwined, where the eternal cycle of growth and renewal reminded all who entered that love was stronger than loss, hope more powerful than despair, and community healing always possible when people chose understanding over vengeance and restoration, over retribution in the endless human work of building heaven on earth through patient attention to the sacred connections that bound all hearts together in the mystery of existence itself. The trees continued their patient growth toward light that had learned to shine through even the darkest conflicts, their branches reaching ever higher while their roots grew ever deeper into soil, enriched by generations of reconciliation and the eternal promise that from every ending would come new beginning, from every loss new possibility, from every wound new wisdom in the endless flowering of love that transformed all suffering into service and all grief into grace.